Madam Chair, the meeting is now live.
Okay, thank you. Good morning, everybody, on this snowy morning, at least in the north. It is 9 o'clock straight up by my computer's clock. So I will call the Public Employees Benefits Program Board meeting to order. Staff, if you would call the roll, please.
Wendy Lunds for the record. I'll begin roll with Laura Freed.
Here.
Linda Fox.
Here.
Betsy Aiello.
Here.
Don Bailey is excused today. April Caron.
Here.
Michelle Kelly.
Here.
Jennifer Krepp. No Jennifer at the moment. Tim Lindley.
Present.
Marcia Irvin.
Here.
Here.
Got you, Jennifer. Thank you. And Tom Verducci.
Here.
Thank you. We have a quorum.
Thank you very much. We have a new board member with us this morning. April, would you please pronounce your last name so that we get it right? I don't want to mispronounce it.
Sure. Last name is pronounced Caron.
Caron. Okay. Everybody, please welcome April Caron to the board. And thank you very much for your willingness to serve. We appreciate that. And we'll try not to bludgeon you with too many policy decisions right out the gate. With that, I will move to agenda item 2, public comment. And I will turn it over to the PEB staff.
Thank you, Madam Chair. For those who have joined for public comment, your name or the last 4 digits of your phone number will be announced, and you will be advised that you've been unmuted. As a reminder for those calling on the phone, please press *6 to unmute. Once you begin speaking, please slowly state and spell your name for the record and then proceed with your comments. Due to time considerations, each caller will be limited to 3 minutes. Kent Irvin, you may begin your comments.
Good morning. Can you hear me?
Yes.
Thank you. Kent Irvin, E-R-V-I-N, for the Nevada Faculty Alliance. I've submitted written comments on agenda items 5, 6, 7, and 9, and we'll try to keep these oral comments brief. We understand the difficult state budget situation, and we are very appreciative that the 12% budget cuts that PEB enacted in November have been partially pulled back. But we are highly troubled by some of the decisions being contemplated today. Board members made hard decisions in November, and you properly chose to avoid elimination of entire benefits in favor of trimming across the board. In particular, you protected the long-term disability insurance benefit. PEB was also able to protect long-term disability in the 2010 cuts, which were much deeper than now. Unfortunately, the recommended executive budget overrode the board decision and eliminated LTD, long-term disability, entirely. Employees who become disabled will be left without a safety net and will be less likely to be able to return to work after a period of rehabilitation or retraining. Instead, they are more likely to become homeless and wards of the state, and that's no exaggeration. PEB has a fundamental duty to prevent catastrophic consequences from health issues of employees. That's one of your major charges and missions. The fact that long-term disability is relatively rare, affecting hundreds at a time, or hundreds over the course of years, maybe 100 at a time, and a few dozen, a couple dozen each year. The fact that LTD is relatively rare does not mean that the protection from the benefit does not apply to all state employees. It does. We don't know when we're going to become disabled or if we will. That's the nature of insurance. PERS disability retirement is no substitute since it is earned only at 2.5% of salary per year of service and would not match the LTD income benefit until 20 or more years of service. Also, most MC faculty are not covered by PERS and do not even have that option. And none of us have Social Security benefits if we've had a state job for the last 5 or 10 years, Social Security disability would not be applied. There is hope, however, that the legislature might restore the LTD benefit based on comments at the Legislative Commission on Monday. Therefore, it is crucial that PEB preserve the option to retain LTD until the rate setting meeting in March. For the rate calculation purposes, LTD should remain in the plan at the reduced levels approved in November, and the contract with the standard should not be canceled at this time. You can wait for that. Those are agenda items 5 and 6. Employee advocates pledge that we will continue to engage with the legislature on budgetary fixes, but respectively request you as PEB board members to retain your authority and fiduciary responsibility to make decisions in the best interest of participants in the program. And also that you advocate with your legislators to help them understand the essential nature of the LTD benefit to prevent catastrophic consequences from health issues of our employees. Thank you very much.
Marlene Lockard, your line is unmuted.
Thank you. Good morning, members of the PEB board. My name is Marlene Lockard, Lockard. I am presenting also I represent the retired public employees of Nevada, and we strongly object to the board's decision in the budget office's decision to lower the employer contribution from $13 to $11 to the HRA. Our seniors are on a fixed income and have come to rely on that current amount to manage their daily lives and their budget. And a little bit of history, because it's important to put the Medicare retirees in perspective. In 2011, Medicare retirees were asked to leave PEB and put in an exchange. At that time, they left considerable money in PEB that had already been appropriated. In addition, that move saves PEB millions of dollars a year, and they don't have to pay any payout for any claims for Medicare retirees. The appropriation from the state for retirees is the same for early retirees in the system and for Medicare retirees. And that's around $400 or $500 per person. So the max that comes back through that $13, $11 contribution to the Medicare retiree is well below the $400 or $500 in employer contribution. So that money stays within PEB. And so to cut the Medicare retiree is just unfair. The employer contribution is there in the budget, far more than the $260 cap. So I too and our organization will be pursuing further adjustments through the legislative process, but we would hope that you would support our efforts there. And the reduction again in life insurance, the one pressing need that our membership had expressed was to increase our life insurance coverage. And now it has been decreased to $7,500, which is far better than the $5,000 approved in November, but far below the needs of the average retiree and senior citizen. So I urge your consideration of these facts and hope that you will support our efforts in the legislative process. Thank you so much.
Caller with the last 4 digits of 0020, please slowly state and spell your name for the record. Reminder to press *6 to unmute. That caller has disengaged. Caller with the last 4 digits of 2244, please slowly state your name for the record and press *6 to unmute.
Hello, my name is Diane Swords. Last name is spelled Swords. I'm a current employee for the state of Nevada, and I am calling, I think, to express the disappointment and dismay that I feel, not only for myself, but for pretty much everybody that I currently work with regard to the changes to the insurance benefits cost structure that's being proposed right now. I am diagnosed with COVID as of last week, so I am very cognizant of the need for robust health insurance coverage. And what I am seeing is, once again, my belief that instead of a fair and equitable method to deal with the devastating economic impacts of COVID, particularly across the board for all state citizens,
Excuse me.
Employees of the state of Nevada. Excuse me.
Hang on one second. I lost connection up here.
Of
If
course.
you guys can you guys hear me?
This is Laura Freed, Capitol Reporters. Is that you? Uh-oh, PEB staff, I think we might have lost our reporter.
I'm happy to wait.
Thank you, ma'am. We appreciate your forbearance with our
Of course.
technical
Of
difficulties.
course. I work with
Hang on one
computers. I
second.
get
I'm
it.
still trying to get you on. Hey, Pete, I have no audio. Like, I don't know what it's on. I told them, let me text Wendy right now because I'm like, I have no audio. Okay, great. They can hear me, but I can't hear them. Is it? Maybe it just froze.
I think you're back on there.
Yeah, I don't know why it went off though. Okay. But I can't hear anybody yet.
Capitol
Hello, can you hear me?
Capitol
Yes, I will
Reporters.
mute. Yeah.
I think we're back. Okay, good.
Yeah, I lost you guys completely, and I was in the middle of, or the last person that was speaking, the public comment.
Okay.
I lost it at where I lost audio was at. She was talking about she is diagnosed with COVID as of last week, so she's very cognizant of the need for robust health insurance coverage. And what I'm seeing is once again, and that's where I lost audio.
Okay, so ma'am, would you, just for the sake of the transcript, would you start your comment from the top? I'm so sorry.
Absolutely. It was fairly unstructured, so that's fine. Once again, my name is Diane Swords, Swords. I am a current employee with the state of Nevada. I've been working for the state for about 12 years. So I was diagnosed with COVID last week. It's been very devastating physically, and as I said previously, I'm definitely aware of the need for robust insurance coverage for all individuals within the state, but of course, my particular concern is for state of Nevada employees. I am very disappointed and actually kind of appalled by the fact that once again, the state of Nevada employees are being asked to make extreme sacrifices in terms of the financial considerations for keeping our medical insurance coverage, along with the fact that every single employee of the state is feeling the impact of the budget cuts for each of the agencies we work for. We are all doing much more work because we have to. We've got positions that are not being replaced. We are under a great deal of stress, and this seems to be the go-to or fallback position of the state whenever there is an economic downturn, rather than fairly and equitably sharing the burdens of recovery among all of the citizens of the state. The focus is on what seems to be what we can pretty much eke out from a state of Nevada employees. My insurance coverage is going to go from zero deductible to a 20% coinsurance. That is unacceptable. Most of the people that I work with feel the same way. Everyone that I talk to feels the same way. However, to be perfectly frank, you may not get a lot of people calling in because we are tired. This has been going on since 2008, more or less. And this is just one more instance of this type of thinking, or this type of almost punitive action toward people who are giving up things to work for the public sector. We work for the public for comparably less money, definitely less in terms of benefits at this point in time, more cost to us, and more hardships in our day-to-day ability to get our jobs done. So if you can just keep in mind that for every person that's calling in, there are many, many, many people that are feeling the same way that I am, just pretty much too discouraged to call in and make this comment. Thank you very much for listening. I'm aware that this is a difficult time for everyone, but please keep in mind that it is also a very difficult time for people that are single parents, head of households, and that have been struggling and working to try to make the best of a difficult fiscal situation for quite some time. Thank you very much.
Caller with the last four digits 0071, please slowly state and spell your name for the record. Reminder to press *6 to unmute.
Hello, can you hear me?
Yes, we can.
Excellent. Good morning. My name is Cameron Hopkins. I am 28 years old, a state employee with DHHS, and a member of AFSCME Local 4041. I speak to you today in opposition to the proposed cuts to healthcare benefits and the proposed hikes in premiums in the midst of a global pandemic, which we're still in. While some state employees have the opportunity to work remotely, many do not. Nevada state employees interact with the public on an almost daily basis in ways that cannot be done remotely. CPS workers still go into people's homes to protect our children. Aging and disability workers need to see that our elderly are safe and corrected.
Excuse me.
Yep.
You need to speak way slower. If you're reading from something, you need to slow down. Sorry.
For the record, this is Laura Freed. That was Capitol reporters for the sake of our transcript. Sorry, sir. Please continue.
Okay. So while some state employees have the opportunity to work remotely, many more do not. Nevada state employees interact with the public on an almost daily basis in ways that cannot be done remotely. CPS workers still need to go into people's homes to protect our children. Aging and disability workers need to see that our elderly are safe, and correction needs to ensure safety in close quarters environments, amongst many others. Public Services sees more people during times of economic upheaval when Nevadans need us more than ever. Even with the greatest precautions, state employees put themselves at risk to serve their fellow Nevadans. The cuts proposed in December were made in haste and during the meeting itself. The cuts proposed in December were also made in anticipation of a 14% shortfall in the budget economic report that was supposed to come out the next week. That 14% shortfall did not materialize and was thankfully overly cautious. However, the medium plan that was proposed in anticipation of that substantial shortfall is still in the PEB plan. The cuts proposed are further cuts to the cuts that were done in the aftermath of the 2008 recession. Benefits were never restored the first time around. Nevada is unique in that state employees here make substantially less than the private and county level equivalents because of previous cuts. We've been in a hiring freeze for months, and because of this, we are hemorrhaging employees. We do not have enough people to maintain the current level of functioning, and you guys are trying to cut more things. Please reconsider balancing the state budget on state workers. Again, I can't even count how many times it's been done. Thank you for your time.
Caller with the last four numbers of 2244. Please slowly state and spell your name for the record, and reminder to press *6 to unmute. That caller has disengaged. Caller with the last four digits of 2733. Please speak and slowly state your name for the record. Reminder, press *6 to unmute.
Good morning to the members of the board. For the record, my name is Jacob Baki, B-A-K-K-E. I'm an administrative faculty at the College of Southern Nevada, where I have worked since I was 18 years old. Because we don't pay into Social Security, I am not eligible for Social Security insurance or disability. I urge the board to consider retaining the long-term disability benefit. I do recognize that a supplemental plan would like to be offered, and I would pay for it, but not everyone will. Some will elect not to, but there will be employees who simply don't know that they are suddenly without that safety net. I don't envy the position of anyone on the board. I know it's a bad situation all around, but I urge you to protect those employees from really catastrophic injury. Thank you.
Caller with the last four digits of 2733. Please speak and slowly state your name for the record, and you may begin your comments. Reminder to press *6 to unmute.
Hello, did you hear that at all?
Yes, we can hear you now. Thank you.
Okay. Good morning to the members of the board. For the record, my name is Jacob Baki, B-A-K-K-E. I'm an administrative faculty member at the College of Southern Nevada, where I worked since I was 18 years old.
Mr. Baki, I apologize. We did hear your original comments.
You did? Okay.
Yeah, and I got your number mixed in with another one. Apologies.
Okay.
Thank
you very much.
Caller with the last four digits of 2733. Please slowly state and spell your name for the record, and reminder, press *6 for the record. That caller is disengaged. Caller with the last four digits of 4404. Please slowly state and spell your name for the record. Reminder to press *6 to unmute.
Good morning. Can you hear me?
Yes, we can hear you.
Good morning, respected chair and committee members. My name is Kevin Ramp, representing numerous active state employees. Aspen Local 4041 is a union that's been around for many, many years and have seen devastating cuts to PEB. Oftentimes, some are not put back in after the crises that the state receives. However, the frontline workers of these recipients of the cuts are the ones that ultimately are the backbone of the state. We provide the services. They provide countless hours provided to the state with very low pay. It's very unfortunate that they have to look at cuts during the time of crisis. This pandemic has not only devastated the state, but has lost lives of state employees and their family members. Health insurance is extremely important during this time and should not be cut, period. We would like to thank Executive Officer Laura Rich and her staff for their continued efforts to meet with us, communicate their concerns prior to each meeting. However, Aspen Local 4041 is against the following changes being proposed today. The 17% increase in deductibles for those on the CDH plan is not acceptable. The 28% increase in out-of-pocket maximum for those on the CDH plan, again, not acceptable. Cutting the HSA contributions for those on the CDH plan, not acceptable. Establishing a deductible for those on the EPO, HMO plans, not acceptable. Establishing a 20% coinsurance for those on the EPO, HMO plans. These HMO and EPO plans, those changes goes against years of past practice and will create unnecessary debt to those involved in that plan, participating in that plan. A 40% reduction in basic life insurance benefits, again, we need to have consistency, not acceptable. Eliminating the long-term disability benefit, as you've heard, state employees are not covered by Social Security. Further, we are being told that COVID-19 will have long-term health effects. They need something to ensure that they have security for their family and themselves going forward. These cuts are not viable to our frontline workers who rely on PEB. Please ask yourself, as board members, have you done everything to ensure the design plan is viable and affordable to all state employees? They are the frontline workers who often do not get recognized for their efforts. State employees for years have worked for more for less and are hired with the premise that Nevada has a great benefit package to compensate for the lower pay. We cannot undo this. We need to improve upon our health insurance package, not take away. PEB board members need to reach out to the governor's office, not just Laura Rich and her staff, but board members need to talk to the governor and his staff to ensure that changes like this do not happen and that PEB receives the necessary funding to be viable and make sure it's affordable for these frontline workers that work hard every day for the citizens of our state. We ask you to defer any changes to the fiscal year 22 plan design until legislators can fund appropriately or make the necessary adjustments today to make the insurance viable and affordable. Please make the right choice. We thank you for your time.
Caller with the last four digits of 9709, please slowly speak your name for the record and press *6 to unmute.
Hello, thank you, Madam Chairwoman and Board, for the opportunity to speak. My name is Matt Leathen, last name Leathen. I am an NC faculty currently teaching at TMCC. I am serving as chair of the Salary and Benefits Committee at TMCC, though I'm only speaking on my own behalf due to the short time frame since the release of the governor's recommended changes to the PEBP plan. I speak to you today in opposition to the governor's recommended elimination of the long-term disability insurance. I want to thank the board for your careful consideration of the long-term disability insurance benefit during the November 23rd board meeting. Even when needing to make a 12% cut in plan costs, you approved maintaining a reduced long-term disability insurance plan. Now that the governor's recommended plan includes a smaller overall cut in plan costs, I urge you to maintain the long-term disability insurance coverage. As the board members are well aware, the majority of NC faculty and many state employees are not eligible for Social Security disability benefits or the CURS disability benefits. Elimination of this benefit from PEBP would create a significant chance for a catastrophic outcome for an employee who becomes disabled. In this time of economic stress, allowing the long-term disability benefit to become an opt-in benefit will likely lead to a disabled employee experiencing a catastrophic situation. I'm asking the board to please stick to your original decision to prioritize maintaining the long-term disability insurance for all employees. Thank you for your time and consideration.
Caller with the last four digits of 5550. Please slowly speak your name for the record and press *6 to unmute.
Good morning, staff. My name is Sarosha Sherfield. Spelling the first name is Serrochia. Last name is Sherfield. I currently work for the state of Nevada as a DMV tech. I am a mother of 3. I'm posing that you guys already have, we have the furloughs already intact, and we're cutting hours everywhere else over there trying to push and shove. Cutting our medical is going to be catastrophic. I have medical issues. I have 3 kids. One of them have a medical issue. And right now, my health by HSA is depleted. So if anything else happens right now, I have nothing to fall back on. Our raises, we're getting shunned on our raises. The union is not really, they're trying to help us get through to you how important that is. You guys, did the furloughs on us and then turned around and deemed us essential. So we're kind of confused of how that's working if we're essential to the community to make sure everybody's driving legally, have their IDs, and have everything set, but then you're cutting our hours, and then you don't want to give us our merit pays and do other little things for us. There are a lot of parents like myself in the DMV that are scared to speak up because they don't know what else to do, but now they're trying to file for welfare and everything else, but yet we can't qualify for that. So where does the line stop? Because right now I have to start looking for another job because of what potentially could be catastrophic to me and my family as far as the medical care. I came from a culinary union where I was there for 17 years. With the state and the county being as big as the culinary, there should be no reason why we can't compete with what culinary does for their people. I came from to where they had their own offices to where we had our own building. We go to that building, everything is taken care of. State and county is lacking in that area big time. And I'm sad to say, but this needs to be prioritized amongst everything else, especially during the COVID-19. Thank you.
Caller with the last four digits of 7947. Please slowly speak your name for the record and press *6 to unmute.
Hi, my name is
Excuse me,
Clarabelle
I think that
Virginia.
I'm having some kind of technical difficulty on my end, and so I'm going to reconnect can I reconnect in a different forum because for whatever reason, it keeps going off my audio, and I didn't realize it till just right now after the last speaker had just quit.
This is Laura Freed. Okay, why don't we take 5 and I'll have PEB staff double check if, since we're recording this and it's being streamed live, how crucial is it that we have Capitol reporters? But let's take 5 while we figure it out.
Okay.
I'm sorry, ma'am. I know you've been waiting to make your public comment, and we will get to you.
No problem. So I'll just mute myself until it's
That
ready.
sounds great. Thank you.
No problem.
Hi. Can, are you good, Shelley? Okay, perfect. Okay. Okay, thank you. Madam Chair, I think we have Capitol reporters straightened out. We should be good to go.
Okay, thank you very much. All right, it's 9:39. Let's call this meeting back to order since now we have the court reporter back, and I will turn it over to PEB staff again, and the lady who is kindly, patiently waiting, I will let her start her comment again. Thank you.
Yes, caller with the last 4 digits of 7947, press *6 to unmute your line, and please restate your name for the record. Yeah.
Hi, my name is Clarabelle Zasanya, and I'm a state employee with the state of Nevada. And and also a ASME local union member, local 4041 union member. I want to thank PEB board because it's, for supporting us. I do appreciate the situation that you're in and that the state finds itself. I do appreciate that the rates have been reduced. However, it's still quite a bit of an increase, and it doesn't make a huge impact when you're when what we're being raised is probably more than what we've been asked to take in furlough. So it's just robbing Peter to pay Paul. So what is also frustrating is that I've been working for the state and pretty much my whole career. I don't contribute to Social Security. So if I get injured or I become extremely ill, I have no backup. I will be severely impacted. My family would be severely impacted because my whole career has been towards state service. And to be put in that situation is kind of scary. Sorry, I'm getting a little emotional because, you never know when somebody will get into an accident. And my mom lives on disability and what Social Security provided her, because she didn't work very much, she didn't have a decent paying job. I don't have that option because I haven't even paid into Social Security significantly. And then, to also take into consideration that these meetings are held when other state employees are working and can't take time off. I really urge this board to start reconsidering the time they hold their meeting so that more members, state employees can be present and can attend these meetings. The other thing I urge this board to do is really to take into consideration the notification to provide. We don't get a mass email saying, hey, we're having a PED board email, so if you'd like to make arrangements with your supervisor so that you can attend. That's not even an option. All that gets posted is what I get notified through my union because PED board isn't proactive in sending this out. We're the ones that are being affected. We should be notified. It should be sent out as soon as you have an agenda. It should be a reminder email. It should be posted everywhere so that state employees are aware of that this meeting is happening and that they're going to be impacted. So I thank everyone for their support, and I appreciate that the governor has come back and is trying his best, but it's not enough, and not in this format that is so crucial to us, which is health insurance and insurance coverage. Thank you.
Caller Chanel Bergren, please slowly state and speak your name, and you may begin your comments. Caller Doug Unger, please state and slowly speak your name, unmute, and you may begin your comments.
Am I unmuted? Can you hear me?
Yes.
Doug Unger, UNGER, member, UNLV Employee Benefits Advisory Committee, and UNLV Chapter President, Nevada Faculty Alliance, and Southern Nevada Government Affairs, for the record. I am sure Chair Freed and distinguished members of the PEB board will agree that the process of determining plan designs and benefit for next year have been unlike any other in Nevada history or since the founding of PEB. This is, of course, because of state budget uncertainties during the economic crisis of the COVID-19 pandemic. But this process has been, in our reading of it, also subjected to mandates and interventions by the governor's office unlike any other, which have affected the decision-making powers of the board. There is good reason for the statutory independence of PEB. The PEB board and its executive officers stand much closer to state employee and public interests. The members of the board are far better informed about potential impacts of plan design changes in response to budget constraints. NRS 287.043 establishes that the board will make these decisions to the best of its abilities and in good conscience independently, to the benefit of state employees in balance with their judgment of the best interests of Nevada citizens. This process has not happened the way it normally would. So the plan designs you are considering on agenda number 5 appear as a fait accompli dictated from on high about which we feel powerless. What we sense in the plan designs you're being asked to approve today is that there may be entrenched, outdated convictions by the powers that be that premiums must be kept low or flat at the expense of other benefits. The impact of this approach is obvious. High out-of-pocket maximums in the CDHP and new PPO plans shift costs to the sickest state employees who can least afford the burden. The cutting of $2 per month to retiree contributions is, in effect, a regressive tax on members living on fixed incomes. And the proposed elimination of long-term disability insurance is dangerous and cruel for workers who, by state and federal agreement, are not covered by Social Security. Thousands of PEB members do not have enough accumulated in PERS to be able to survive being disabled for very long. And the 7,000 higher education faculty would be left with nothing should they face an illness or accident that prevents them from working, or if they contract COVID-19 and be among the growing number of cases who suffer a long-term disability. Just yesterday, I was contacted by a representative of the UNLV School of Medicine, a physician who works on the front line with her staff. They are very concerned about risking their lives without having long-term disability insurance. This is a dangerous oversight, and it must be fixed somehow by the PEB board in its actions today. Looking to the future, we ask for an in-depth discussion by the board of the ethics and ideology of the approach to keep premiums low or flat, balanced against financial burdens to the health and lives of state employees who suffer from serious illnesses and to retirees who see their fixed incomes reduced so that the healthy and young may pay less. This discussion should go to the heart of what health insurance is and benefits should be for future plan designs. Deciding this will better enable the board to determine a more stable and more just approach to future policy. Thank you to Executive Officer Laura Rich for her continued outreach and openness to state employee advocates and for her willingness to listen to the concerns of the many thousands of state employee, faculty, retirees, and PEB members we represent. Thank you to all who serve on the PEB board for your consideration, for the time and care you devote to your discussions and deliberations, and for your wisdom. Thank you.
Caller with the last 4 digits, 7338. Please slowly state your name for the record and press *6 to unmute.
Good morning, Chair Freed and members of the board. Can you hear me okay?
Yes, we can hear you.
Thank you. This is Priscilla Maloney, Priscilla Maloney. You've heard a lot of, representing the AFSCME 4041 retiree chapter. You've heard a lot of moving and impactful comments today from our state workforce. I would like to say that those are the folks that we really need to listen to in this time of crisis. I also want to thank Dr. Irvin, Doug Unger, Ms. Lockhart for their comments. I would only let the board know, I'll try and be brief here, that the AFSCME retirees did submit written public comment on the December 16th interim retiree benefits committee board meeting. And then on January 25th, I'm sorry, that was 2020. And then January 25th, 2021, we also submitted written public comments, and those documents are available. And again, Dr. Irvin, Ms. Lockhart, Mr. Unger, or Dr. Unger have covered basically everything that we feel needs to be looked at very closely today. We would say that we do appreciate that the life insurance benefit cut was somewhat mitigated by the governor's recommended budget, but that $7,500 barely covers the cost of a burial. And so, again, I thank the board for this work in this difficult time, but would implore you to please listen to the voices that you're hearing from the actual employees and retirees that are going to be suffering under the burden of these cuts. Thank you very much.
Caller with the last four digits of 7800, please speak and slowly state your name and press *6 to unmute. Caller is not responding. Madam Chair, that concludes our public comment.
Okay, thank you very much. And reminder to anybody listening or watching, there will be another public comment period at the end of the meeting. So with that, I'll go to agenda item 3, PEB board disclosures, and toss it to the Deputy Attorney General.
Thank you, Madam Chair. Brandy Mooneyhan, Deputy Attorney General, for the record. This agenda item allows me to make a disclosure on behalf of the board members who are eligible for PEB benefits. Of course, most of the items on today's agenda will have an indirect effect on the benefits available to PEB members. In particular, item 5, which in part deals with approval of certain elements of the plan design for plan year 2022, may eventually directly affect the PEB benefits available to members. So pursuant to NRS 281A.420, on behalf of the board members who are eligible for PEB benefits, I offer this disclosure that those members will be voting on items that may affect the benefits available to them and or their family members. I note that the law does not preclude them from voting on these items, but I would like to make the disclosure. I also invite any member who has any additional disclosures to make to do so now. Thank you.
Okay, then Laura Freed for the record, hearing none, we'll move on to agenda item 4. Board members, this is the consent agenda, a whole bunch of reports on from various vendors, and I hope you've all had a chance to peruse them. And if any board member wants to pull any of these items for discussion, please let me know now.
This is Betsy Aiello, and I'll just have a statement I'd like to make on the United Health report.
Okay, please go ahead.
Okay, that was quick. When we approve, I would like to add a statement that looking through the report, there was more than one page where the information in the tables would show a negative, but the text relating to those tables would show a positive. An example would be on page 6, where the table says that PCP visits and specialist visits had decreases in this past year, but the text regarding it says both increased from the prior period. So I think that the data presented is probably accurate, but that the tables might not, or the
text around some of the data might not have been updated in this report. So I would like that United would look at the report and make it consistent. That's just my statement there.
Okay, thank you. Anybody else? Are there any consent items you want to pull?
It's Michelle Kelly here. I have brief questions on the action minutes themselves, as well as 4.3.6, the PPO network.
Okay, so let's pull 4.1, 4.3.6, Hometown Health Providers and Sierra Healthcare Options PPO Network. And as for myself, I would like to pull 4.5, Appeals and Complaints. Going once, going twice. Okay, I will entertain a motion to approve or accept all of these reports on the consent agenda, save the ones I just mentioned.
Linda Fox, for the record, I will make that motion.
Thank you. Do I have a second?
Tim Lindley, for the record, I'll second.
Great, thank you. All in favor, please signify by saying aye or wave your palm at the screen.
Aye.
Aye. Any oh, thank you, Jennifer. Any opposed, say no. Okay, motion carries unanimously. All right, so let's go back to 4.1. Member Kelly.
Yes, thank you, Jeffrey. So it's really just a question. So I noticed that in the attendees of the action minutes, the staff are listed, the board's listed, public comment is listed, but the experts that we relied upon for data, namely Aon, is not listed. And so I'm wondering why, when we rely on information provided by that group, that they wouldn't be in the attendees list. And I would like to request going forward, I guess, that they would be included on the attendees list.
And this is Laura Rich for the record. I don't see why we can't. Ms. Mooneyhan, if you want to weigh in on this, I don't see a reason why we can't, but maybe if legal just wants to provide an opinion.
Sure. There's no legal prohibition on including the names. If you would like to include them, that would be fine.
Okay, right, then we'll list them as witnesses going forward. That's fine. Member Kelly, does that take care of your action minutes concerns from November 23rd?
Yes, it does. Thank you.
Okay. Would you like to then go on to your questions on 4.3.6?
Yes. So thank you, Jeffrey. So the PPO network, the service level agreement report is included in that documentation, and there is a fail listed. And so I was just wondering if staff could tell us what the penalty is for that particular fail.
For the record, Laura Rich, yes, that particular fail is under the performance guarantees, and it is 2% of the administrative fees that are assessed during that quarter. And that equals to, I believe, about $7,200 of a penalty.
Okay, thank you. And can you briefly just share with us why they failed that metric?
So that metric, and I'm pulling it up right here. Give me 1 second. That metric specifically says turnaround time for repricing of medical claims within 3 business days of receipt. So the way that that process works is when a claim comes in, from a provider, it then gets sent to the network for repricing. And they have a performance guarantee surrounding the time that they can take for repricing. This is not, obviously, it's not the first time that Hometown Health has failed this performance measure. They're taking longer than that, those 3 business days to process them. As to why, I don't know. I can't give you a reason why. I don't know what is causing the lag. It's something that I can definitely reach out to Hometown Health and ask them as to why, but I do want to point out that their contract is expiring as of June 30th, and you'll see in a different report that there will be a new vendor.
Great. Thank you, Executive Officer Rich. Just one thing you said, and I wonder if there's not an opportunity here. You indicated that this is not the first time they've failed this particular metric. And I'm wondering if there's an escalation penalty in the SLA whereby if they fail it multiple times in a row or multiple times in a 12-month period, that the penalty actually escalates. And if there's not one of those, is it possible in ongoing contracts to perhaps include that, since it's a fairly important piece of our contract?
For the record, Laura Rich, yes. So there is no performance guarantee that escalates the penalty, but we did look at this moving forward with the new contract. I will have to say that we haven't experienced this with other we actually have a national network through Aetna, and we don't have that issue through Aetna. We also don't have that issue through the Sierra Healthcare options in the South. This has been isolated to Hometown Health, but it was definitely something we looked at, and we did change the penalties or the performance guarantees with this new contract that will be replacing it in July.
Great, thank you. And that's all I had, Chairperson Freed. Thank you.
Okay, great, thanks. Okay, so let's go to 4.5. Board members, I pulled this because I wanted to, as I was going through the number of complaints about our various vendors, as well as complaints about PEB itself, I couldn't help but notice that Express Scripts has the most complaints for 2020, although certainly some of the HealthScope stuff comes a close second. And the reason that caught my eye is because last fall, I became aware of a situation with one of our participants who is on a specialty medicine, who had a pretty rough time with ESI and Accredo, the specialty drug sub for ESI. And you folks who were on the board last year might remember that we implemented the Save On program in March of 2020. And this was done to be able to leverage some of the patient assistance programs that are out there with the pharmaceutical companies. Anyway, so I, had been made aware of this participant's difficulties. And just also for your information, we have approximately 500 people on specialty drugs in the program. So I wanted to ask some questions about how ESI and Accredo make sure that some of our specialty drug participants are not getting the bureaucratic runaround that this participant experienced. So, if Ms. Williams can come on for just a little bit, I have a couple of questions relative to how benefits are coordinated for specialty drugs. And I want to be clear here. I don't want to take up the board's time. This is a big agenda, and ESI and Accredo can send the board a letter explaining the answers to some of these things, so we don't have to take a bunch of time, but I did want to get a couple of things on the record if I could.
Sure. Hello there. This is Amy Williams with Express Scripts. Can you hear me okay?
I can. Thank you, Ms. Williams. Thank you for joining us.
You're welcome. I apologize for if you can't see me very well. I'm hiding from kids working virtually.
I think that's one of the things about this pandemic. It's really revealed our collective humanity of, broadcasting from our bedrooms and places like that.
You got that right. Yes. I'm happy to join today.
Thank you. So, okay, how quickly are billing issues for specialty drugs elevated to ESI account managers?
Sure. So when it comes to specialty drugs and around especially copay assistance when they're involved, and I do escalate. If a member calls into our customer service team, and if they are not able to answer the questions that member has, the process is they pull in what we call our resolution team lead, so the next step up in service. And then beyond that, if it's something that involves accumulators, especially in this specific case, shared accumulator with the medical vendor. Also, this specific case, it involved a program that PEB was involved in as well. So in those situations, they do pull in the account team, myself specifically, to help answer questions and pull in all the necessary teams to help kind of come to resolution.
Okay. In the particular case I've been made aware of, the participant was told that the Save On program was mandatory, except it's optional. Have the reps been given the training to give participants on specialty drugs that correct information now?
Yeah, most definitely. I know this particular situation. I know a lot of the billing concerns were prior to Save On being implemented. And so I can speak to that quickly if I could, because I just wanted to share some things that I have since learned in conversation. Sure. So with a specialty claim, when there is an adjustment, since our system automatically looks to deduct those copay assistance dollars from an accumulator versus, of course, add them back in and further them to satisfy their out-of-pocket. It does take a bit more time for an adjustment of a specialty claim. I've learned that it is actually a file transfer process to our internal warehouse, as well as possibly extra steps in communicating with the outside vendor for copay assistance. And so that does take some time, and we saw that delay impact the specific member and how her future claims adjudicated here and with HealthScope. What's I'm happy to share is that it's slated for 2021. We have enhancements in the pipeline to help to make that more real time when it comes to adjustments with specialty claims. And so that is something that is reassuring. I know now that we're talking about Save On, that doesn't come into play, but I wanted to make sure I mentioned that. It's something that is great to hear with her past experience.
Right. Yeah. I mean, so if Save On's optional, specialty drug claims are not automatically being denied then, like it was in her case.
Yeah, so with Save On, it is an optional program. It is when that was first implemented. Of course, as you all probably know, that Save On reaches out to those members to accept them into the program, help educate them, and get their approval to enroll in the program. And this specific case, she declined, but she had declined and then hung up the phone. And per our contract with Save On, they needed the opportunity to educate so that they can know how a claim is going to process, and that wasn't able to be done. So as the member thought she had declined and opted out, she later found those roadblocks, of course, trying to fill it through her own means at the retail through the pharmacy. And so she called back to our customer service team, and you're correct. We did find that there was some error in them stating that they need to. In other words, took it as mandatory, need to participate in that program. In all those situations, we pull those calls, those reps are definitely coached. That's sent to their leadership to have a meeting with them about that.
Okay, so when Accredo reaches out to people who have been prescribed specialty drugs, they get both the participant and the staff gets coached that this is the process now.
Right. Yeah.
Okay.
And I mean,
okay.
Yeah. Yes.
Okay. Thank you. I appreciate the clarity around this. I should make clear for you and for the board that I was concerned about this one participant, but in the broader sense, I'm concerned that folks who are on specialty drugs have chronic conditions, and they perhaps have less, physical and psychic energy for, fighting a bureaucracy than somebody like me who's healthy. And, when I have to call HealthScope and ask them to re-adjudicate my claim because I think they made an error, I find that annoying enough, and I'm, healthy and have all my faculties and stuff. So mostly I wanted to make sure that there are guardrails for our folks on specialty drugs, that they're getting the right information, they're they're getting the help that they need because, again, they are chronically ill participants. So thank you, Ms. Williams. I appreciate your testimony and I appreciate the board's indulgence in this particular subject for a few minutes.
You're welcome. If you have any other questions, feel free to have them sent out through Ms. Rich, and I'm happy to answer any questions you have.
Okay, great. Thanks. Okay, board members, with that, do I have a motion to approve the action minutes 4.5 and 4.3.6? Did I get that right?
Linda Fox, for the record, I will make that motion.
Michelle Kelly here, I'll second.
Great, thank you. All in favor, say aye.
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 Jennifer Krupp, aye.
Okay. Any opposed, say no. Okay, motion carries. Does the board want a break before we launch into item 5? Okay. All right, it's 10:10. We'll return at 10:15. Thanks, everyone. All right. Once again, this is Laura Freed. It's 10:16 a.m. You guys got an extra minute. I'll call the meeting back to order. And if staff is ready, we will go to agenda item 5, Governor's recommended budget for the 2022-23 biennium.
Sorry, I was on mute. Okay, so for the record, Laura Rich. To refresh the board, on November 23rd, 2020, the PEB board met and approved Plan Year 22 plan design based on the 12% budget reserve requirements that were issued by the Governor's Finance Office on November 3rd. That was a total of $36 million per plan year. So the board made various plan design changes, including the addition of a new plan, but that did not get us to $36 million alone. So the board had to make some additional changes. So there was the decision to implement the out-of-network billed charges negotiated by using the 140% Medicare model rather than fair health standards. We also implemented Smart 90 on the EPO and low deductible plan, and the Advantage network to all 3 plans. We also reduced the Medicare HRA contribution from $13 to $11 per year of service. There was a reduction of life insurance, the basic life insurance benefit, from $25,000 and $12,500, what it is today, to 10 and 5, 10,000 for actives and 5,000 for retirees. And we also reduced the long-term disability benefit to a 50% benefit. Additionally, we unbundled the dental premium, which added a significant surcharge, I guess if you want to call it that, to the overall rates. So that adjusted agency request budget was submitted the following day to the Governor's Finance Office, and that reflected the board's decisions. On January 18th, the governor released his recommended budget, which for PEB included some very welcome funding back to the program. The budget was successful in minimizing the impact to state employees by not just eliminating furloughs, but also through the preservation of medical benefits and stable premiums. In the budget highlights, the governor includes the following statement. The governor's budget prioritizes the health and well-being of state employees, retirees, and their families who will continue to have access to an excellent medical benefit package through PEB. It is more crucial than ever for state employees to have access to options that fit their unique healthcare needs. PEB will expand the coverage options offered through the program in the upcoming biennium to include a new low deductible copay-based option. In addition to increased choice, premiums are expected to remain stable for the upcoming plan year. So the cuts to the budget are significantly less than the original 12%. It's about half of that at 6%. Most of the additional funding that was given back to PEB was directed to first dollar coverage. So lowering deductibles, increasing that HSA contribution, and also keeping rates stable. So I think the one thing we can hang our hat on this is that, we really do have a low deductible plan. This has been something that members have been begging and pleading PEB for to bring back for years, ever since the introduction of the high deductible plan. And we've finally been able to do that with the governor's support through his budget recommendations. As you can see on the grid, all of the deductibles and out-of-pocket maximums were reduced from the earlier 12% version as well. And but unfortunately, with all those successes, there's also some sacrifices that have to be made. The basic life insurance benefit was also reduced, but actually not as much as what the board had approved in November. In GovRec, the life insurance is actually at $15,000 for actives and $7,500 for retirees. And I think the goal here was to keep that benefit at a level sufficient to cover the cost of a burial. The budget also maintains the $13 to $11 reduction in HRA contribution as well. So lastly, something we've heard a lot about through public comment, the LTD was eliminated. Unfortunately, the state is facing some fiscal challenges, and with that has, there's big decisions and difficult decisions that have to be made. So, keeping with the focus of reducing barriers to access to care and reducing that first dollar coverage, really that the long-term disability, it was a relatively low utilized benefit, and it does come at a very significant cost. It's about $9 million for the biennium. It's also a benefit that can be purchased by members on an individual basis, and a benefit that PEB will be working very, very hard to add to our menu of voluntary products, if not, likely not this coming open enrollment, but when we introduce our new eligibility system, it should be a part of those voluntary products. And that will be in January. So there may be a 6-month gap, but we are going to work really hard to make sure that we can introduce that as a voluntary product. So overall, despite all of the budget challenges the governor and his budget staff were faced with, I think that PEB actually came out quite well. We are able to offer more choices and access without having to significantly raise rates. And that really aligns with the PEB mission statement that we provide employees, retirees, and their families with access to high quality benefits at affordable prices. So PEB really appreciates the support of the governor and his staff, and we are grateful that such a high priority was placed on employee medical benefits. Before I move into the recommendation, I want to pause here and explain that there were some legal questions that PEB explored regarding the options and actions that the board could take at this point. The governor has presented a recommended budget, and which for PEB is really expressed in the form of plan design. So at this point, the governor's budget is now in the hands of the legislature. So that leaves the question, does the board at this point have the ability to make adjustments to plan design? So I think rather than me try and explain the legalities, I think I'm going to ask our Deputy Attorney General, Ms. Mooneyhan, to jump in here. Brandy, if you want to jump in.
Sure. Just to be clear, of course, the PEB board does not have the authority to override the governor's recommended budget. The governor retains the executive power, the ultimate executive power. However, I think this agenda item is designed to allow the board to approve the plan design changes that are going to arise out of the governor's recommendations pursuant to NRS 287-043. The board has broad powers to carry out the Public Employees Benefits Program, and that of course includes the details of how that is going to be designed. Technically, the plan design is distinct from the budget, though it has to be kept in mind they're very closely intertwined. Should also be kept in mind that both the state budget and plan design are ongoing processes that go on all year, and neither are final yet for this year. But traditionally, any potential changes to the plan design are presented to the board for its information, discussion, and approval so that staff can go ahead and proceed in developing the plan design as that is contemplated by the budget at this point.
So the recommendation here, thank you, Ms. Mooneyhan. The recommendation here is for the board to approve the plan design as expressed in the table on page 2. Also, since the changes in life insurance and long-term disability do not reflect the decisions that were made by the board in November, the board must also approve the reduction to life insurance and the elimination of LTD as well.
This is Laura Freed. Okay, I'm sorry. Did I cut off your presentation? Okay. Thank you, Ms. Rich. So let me make sure I understand the intersection here of budget, fiscal policy, and program policy. So our Deputy Attorney General said the PEB board doesn't have the authority to override the governor's recommended budget. If that's true, then what statutory requirement exists to make the board ratify the governor's recommended budget? Because essentially that's, what you're asking us to do, if I'm understanding the staff report correctly. So are we required to take action on something that is not our statutory purview? In other words, we do the plan design, the policy stuff, and the governor's finance office and the governor has the prerogative to fund whatever he feels he can and should. And so are we overstepping into fiscal policy if the board takes action of some kind other than just ratification of GovRec? Does that make sense? Is my question clear enough for everybody?
This is Laura Rich. I think your question is clear. It's just not clear who it's to. Is it to staff or is it to the board?
No, it's to staff and specifically to Ms. Mooneyhan, I think, because she's read 287 probably a lot more than me in her life.
Yeah, Brandy Mooneyhan, Deputy Attorney General for the record. Traditionally, PEB, when changes to the budget may impact plan design, traditionally the executive officer has consulted with the board because it is a policy decision to make those tweaks. A lot of work, of course, goes into designing the plan, and I think staff is seeking here permission to proceed with the budget as it has been recommended by the governor today, keeping in mind that we will probably be discussing this again in March.
Okay, thank you. Understood. So with that, I have myself a detailed question, but I would yield to the board. What kind of mechanical questions or budgetary questions do you have of PEB staff?
This is Betsy, and I think it might be the question you just asked, Laura, and I think it's a tough one to answer, both Laura Rich and Brandy. It's hard for me if the governor has passed he's presented the budget to the legislature, and the budget is in the hands of the legislature for all of the debate and the finalization of the budget. Really, we sent our recommendations, which every agency does with agency request. Then always in my whole career, it's been changed at the governor's office and it's become the governor's recommended budget, but nobody has asked that agency, and we're like the chief of the agency, from my understanding, to go ahead and say, yes, I agree with the governor's budget, or no, I don't. So it's hard for me, and I know that, I think this is what you asked, Laura, it's hard for me to say we would approve or disapprove because we just implement the budget that is finalized by the legislature. So this is not really even probably the plan that's going to happen, but it may be. And so it's hard for me to understand why we would vote on it when we really have no input other than to what we may want to to state on public record or something, but actual authority. So it's still confusing or hard for me to totally understand that, because I think the budget the legislature turns back around to you is the one you actually implement, I think. So.
This is Laura Freed. Thank you, Betsy. That is, you have articulated, yes, some of the inherent confusion between having the board approve a plan design and PEB staff incorporate that plan design into its agency request. And then you're right, the governor changes things as governors do. And then it goes to the legislature and they might change things as legislatures do. And then that's what you get. And those of us who have, been in agencies and run agencies are very much used to that. PEB is a little weird in the sense that when we, for instance, set rates in the second year of the biennium, the legislature is not in session. And sometimes PEB has more revenue or less revenue than what was legislatively approved. So necessarily, for instance, in the second year of the biennium, you're going to be tweaking plan design to accommodate the funding you have. And so I understand why it is a gray area. However, I would say that PEB hasn't even had a budget hearing yet. That's the other thing. It's perhaps premature for this board to make any changes to any of the plan design until we see what the legislative money committees think about the governor's recommended budget. That's my feeling. And Ms. Rich, you may, since I didn't watch your pre-session budget hearing, I don't know if you can say how the governor's recommended budget for PEB was received by the Legislative Commission's Budget Subcommittee, and if you got any indication from them. But that's my feeling, that if our legal counsel is telling us, okay, we think you need to essentially ratify the governor's recommended budget, I'm willing to do that, but I'm not necessarily interested in policy changes to plan design that don't conform to GovRec until I see how the legislature feels about this. So other board members, please feel free to chime in.
Just to be clear, I don't think the action item here is ratifying the governor's budget itself. I think staff is looking for approval to proceed in this direction, okay, so they can get ready to move in that direction, knowing that things may change. Okay, sorry. This is Laura Freed for the record. Perhaps I was glib. I approve the plan design that GovRec is predicated upon, perhaps would be a more precise way to put it.
So it's Michelle Kelly here for the record. And, I'm as confused as everybody else. But I also think I'm coming at this maybe from a little bit of a different angle, because if we go ahead and just ratify or uphold his plan design, we're saying that's our choice, that's our plan design. And I would, some of the public comment pointed to the fact that this year the process has been very different from any I've experienced in my time with the state, where absolutely it is the governor's prerogative to go ahead and, set the budget for the entire state. And generally, PEBP has been given a target, such as the 12% that we worked on back in November, to set plan design. This is, I've been in the system since 2005. This is the first time I've seen a governor's finance office actually design the benefit plan for us and then give it to us. So I am concerned about just going ahead and approving this as in GovRec, because I don't necessarily agree with some of the choices that have been made, and they are choices. They're choices not made by people on the board who are fiduciaries to the plan, I might say. So we're fiduciaries to both our participants and the state, but rather where we would be rubber stamping something that we haven't discussed. And so while I'm thankful, I'm truly thankful that the Governor's Finance Office did find that additional money and reduce the cuts to 6%, I think that it is incumbent upon the board to do plan design. And so I have some written comments here that I would like to get on the record, you know, because I do think that it's important that, you know, that we're watching plan design. We've heard from all of our participants this morning. I'm sure everybody's had outreaches from different participants as well. You know, I understand that in this economic climate, hard decisions have been made. Hard decisions were also made in 2008 and 2010, you know. So we're getting used to having to dig out of these big holes, I would say, unfortunately. But at the same time, you know, I think that our job is plan design, and Governor's job is to kind of to give us a budget, which he's done, and he's taken it a bit further. I do want to, since I've got the floor, I'm just going to go through my remarks, if you don't mind, Chairperson Freed. First of all,
I do not mind. Please go ahead.
I do want to thank all of the employees, you know, the state employees who gave public comment this morning, the Nevada System of Higher Education people who've shown up and given comments. It's very intimidating to give comments during public comment periods, and especially when we're all very tired, we're all very emotional at the moment. But one thing that really struck me from all the public comments is just how dedicated people are to themselves, to their colleagues, and to their community. Because I think overwhelmingly what we heard from people is they're concerned about co-workers, they're concerned about people they work with who maybe don't earn as much. And so like the caring that runs through Nevada, you know, is so gratifying during these difficult times. And so while I said I'm grateful that the governor has found those additional monies, I would be remiss if I didn't point out that the maximum out of pockets are still $5,000 and $10,000. You know, this change, that alone is going to cause hardship and could lead to participants not staying compliant with their treatment plans, right? And if they don't stay compliant with treatment plans, it leads to higher costs for us down the line, for the plan down the line. So that's a concern. I'm obviously extremely concerned about long-term disability. I'm going to refer to it going forward as LTD. Very concerned about the elimination of that plan because of its import to all state employees. We don't have Social Security disability. And yes, I hear Executive Officer Rich saying that it's not highly used, but everybody actually does use it because it's our safety net. And so yes, there's I think around 111 people claiming on long-term disability at the moment, but that benefits all of us. So these changes that increase the max out of pocket and eliminate the LTD, you know, as everyone has commented, are happening during a pandemic. And a pandemic that's having long-term effects on participants from a physical health standpoint, but also from a mental health standpoint, you know, where employees are doing it so tough at the moment. And so this will just be another worry laid on top of it. And of course, for someone who doesn't have LTD, the first thing that happens is they exhaust the health insurance plan. And if they don't have cash, then they're putting $5,000 to $10,000 on their credit card. Then they become unemployed because they can't do their job and there's no income safety net. So then they face eviction and foreclosure. And so the consequences of not having these safety nets is dire. So I would say that I'm coming to the end. I'm sorry, Chairperson Freed. So LTD is critically important to the state employees. You know, it replaces Social Security. The concern, I think there's lots of open questions about that LTD too. We heard from Executive Officer Rich that she's going to do her best to get a supplemental plan in place, but it most likely will be 2022. So what happens in the 6-month interim
eliminating this benefit in such a rush means there's no time to evaluate the consequences of the move. So I think the board needs to step back and take some time. You know, the questions are, how quickly can PEB add a voluntary product to replace this? What's the rate structure going to look like? I can tell you out of curiosity, yesterday, I went out to Google and found a long-term disability calculator where it kind of refers you out to insurance providers. All I put in was my state of employment, my gender, and my age. And it asked me for an income replacement. It gave me a cap of $3,700, and it gave me a rank. Even before I got to evidence of insurability, it was telling me the premiums were going to be in the range of $288 all the way up to $380. So for me, for what's costing PEBP $14 a month would end up costing me more than $300 a month. And that's if they'll even insure me, right? So I think the board needs to understand exactly what that's going to look like if and when the benefit's eliminated. In addition, what about insurability? You know, we've got lots of employees who are kind of getting up there in the age brackets, and the older you are, the less the insurance carriers want you. And so I would say, are we going to be able to guarantee that every state employee who wants to continue that long-term disability insurance can continue that long-term disability insurance? You know, and what's it going to cost? And then if we have to have a 6-month break, is there going to be a guaranteed issue? How will that work? Can everybody get covered after a break? And so there's just lots of questions that I have that I don't think there's any answers to. And so just lastly, so obviously these changes to the max out of pocket and to LTD, they really do impact the most vulnerable state employees. And without the support of benefits, they end up just on a different line of support from the state. So they end up in Medicaid and the various other agencies, you know, getting supported by the state. So I think eliminating safety nets is somewhat short-sighted. And with that, I will thank you for your time.
You're welcome. You said something interesting that I wanted to follow up on. That you seem to be advocating for an action other than staff's recommendation. And do I have that right? And if yes, what action are you suggesting?
I guess I'm advocating that the board take the number that the governor has provided us with, or provided staff with, because I don't think we've actually seen that, but I believe it's 6% savings. And I believe it's the responsibility of the board to use that number to design the plan.
So you're suggesting changing plan design within the authorized subsidy dollars that the governor has recommended, but doing something different with plan design than GovRec.
Yes, I don't know if we can do that. Ultimately, yes, I think that we also need to be working on with the legislature, but I do think LTD should be continued, and I'm not sure how we get to that any other way than redesigning within the figure he's provided.
Okay, right. And so if for instance, you're advocating bringing LTD back at some percentage, what then would you cut to make it equal?
That's the question, right? I mean, we come back to the COVID surcharge. I would rather spend $14 a month extra in my premium than $300 a month to buy a product on the open market. So we could, you know, I mean.
Okay, wait, where did you get the $14?
Oh, so the $14 is the amount of the monthly cost to a participant or the employee of the current long-term disability program. But I would remind the chair that we had actually already reduced that. We'd reduced it from a max of $60
correct
to $500, And that hasn't been priced out, the reduction.
So,
yet.
okay, so is the $14 to bring back 50% or 60% or all of it or 100%?
Right now, I think the $14 relates to 60% and 7,500. I think what we've heard is that people are okay with 50% and 5,000, but we don't have that price, but it would be less than 14. So
okay. I just want to get that on the record because it sounds like you got information maybe from PEB staff that the rest of the board didn't have. So I wasn't clear on what percentage LTD. Okay, so here's another question. Are you said COVID surcharge, it's the return of the COVID surcharge. So you're suggesting that the board should consider raising rates, which and COVID, and whether it's a COVID surcharge or an LTD surcharge or whatever you call it, that's adding to the participant share of the monthly premium. So in other words, going to the chart on page 2, let's say GovRec employee only $46.72, and you said 14. So $60 a month instead of $46 or $47 a month, so that everybody can have LTD.
So that everybody has the safety net of income replacement should they become catastrophically injured or critically ill and be unable to do their job for more than 180 days. Yes.
Okay. Okay. All right. Other board members, would you like to weigh in on this possibility?
Yes.
This is Betsy. I just want to bring up again, from my understanding, usually agency requests and then governor's rec have to do with the policy as well as the dollars tied to the policy, from my understanding. So the governors aren't just giving each agency a dollar figure based on a scenario, but they're believing in the policy they're presenting to the public. Now, I totally agree. I believe totally in long-term care disability insurance, and it's hard, but my understanding is Governor Rec isn't just putting together a formula to come up with a total dollar amount, going back to the agency and saying, build your agency with this money. But again, maybe Ms. Mooneyhan can talk more to the legal side of that, but this is all hurting me so much. What a retirement activity I decided to do.
Yeah, Betsy, congratulations. You found yourself a real good hobby. This is Laura Freed. I agree with you, what you said about, it being rather non-standard to have GovRec and have it be a dollar amount and then go back to a policy making board and say, okay, make it fit in whatever this is. I mean, no, I mean, it is the job of the executive branch to support the governor's recommendation. And I stand by what I said. I'm not sure this discussion is ripe yet because the legislature hasn't even reacted to it. And if you go back through the history of, PEB, since the beginning of the Great Recession, PEB, the legislature has shown a willingness to mitigate some of the PEB plan designs that we've all felt were pretty tough on participants. Those of you who've been around a long time will remember that the 2011 legislature certainly cut and changed PEB's plan design fundamentally, but did not take the SAGE Commission recommendations, if you guys remember those. And, so I want to respect the legislative branch's prerogative enough to let them weigh in. And that's my feeling on that. But I'm open to other comments from other board members and comments generally on staff's report too. So please feel free to jump in, folks.
Yes, Tom Verducci for the record.
Please go ahead.
Thank you, Chair Freed. I believe there has to be a contingency plan put in place where we're going to be disadvantaging our most vulnerable group, the group that becomes disabled. And I appreciate the fact that We've had some relief to the cuts that were approved in November, but I haven't heard any testimony or anyone support the idea of completely eliminating a benefit, the long-term disability. And the reason we have a board is to deliberate on plan design. And I see that we're leaving a gap here. I heard 6 months that PEB expects to be offering a voluntary plan, but what about the poor soul that becomes disabled in that 6-month period? This is the vulnerable group. And when we go from a group plan where there are several employees covered to a voluntary plan, the insurance company is going to have less members to cover, and the premium should go up. And I do believe this is the public employees benefit plan. It belongs to them. And we heard compelling testimony that the members want to retain this benefit. And our original decision back in November was not to eliminate any specific benefit. And there's no Social Security that's covered. Our mission is to protect our members from a catastrophic event, and we very well could be putting them in a situation of catastrophe. And I also believe there's potential legislation that I'm hearing to restore benefits, but we're in a period here where there's no contingency plan that's put in place other than shutting down this particular benefit. And I think the purpose of the plan design and the purpose of the board is to deliberate on plan design. And I understand that we're in a very tricky situation here, but I am not real crazy about eliminating a benefit without any backup plan that's firmly in place.
Okay, thank you, Mr. Verducci. But you look like you might have more to say.
No, that's my major thought. I listened to the groups, and I didn't hear anyone come out and say, this is something that we should be giving up. And I worry about the individual employee during this period that becomes disabled, no Social Security. And I just think there has to be further deliberation. And I think it's premature to completely cut a benefit. And I know we have other items here to discuss, but this is the one that really jumps out to me.
Okay. I'm going to throw it to Mr. Lindley, who has been patiently waiting to chat about his thought.
Thank you very much, Chair Freed. Tim Lindley for the record. I did review the plan, and I do recall, well, a couple of thoughts come to my mind. In the prior board meeting, we did do some pretty heavy proposed cuts, 12%. I mean, you can see it in the agenda item, $2,000 deductible for the CDHP, $1,000 deductible for the new low deductible PPO, and then the HMO went up to $500, and the premiums drastically increased for individuals, including families. And my position in the prior board meeting was, I'm going to be hit with furloughs. Other active employees will be hit with furloughs, which is effectively a 5% cut. And I wanted to not take more money out of their paychecks. And seeing the governor's recommendation, an individual going from $44 to $46, $47, I'm rounding, of course, or a family plan such as myself going from $301 to $304 is a very, it's a lot easier to swallow. And I personally appreciate the governor's recommendation, and I do empathize, or I also appreciate the comments made by board member Verducci regarding the LTD disability. But at this point in time, I like the Gov's rec, and I do recognize Chairwoman Freed's position on, do we vote on it now or do we wait for the legislature? So those are my comments. Thank you.
More Sherman for the record. I'm definitely against eliminating the LTD. I understand that a monthly cost is difficult for families, but if something happened to that breadwinner then what would that family do? Because they'd have nothing. And no, there's no way I could handle that. So I'm against the cutting of the LTD.
Okay. Anybody else?
In regards to cutting out, Tim Lindley here for the record. In regards to cutting LTD, Chairman Freed, I think you kind of hit it on the head. The legislature could easily change this. Am I correct in that assumption?
This is Laura Freed for the record. Yes, you are, and they certainly could.
All right, that was all. Thank you.
Marcia Urban for the record. So then why are we voting for it if we really don't know what we're voting for? I mean, it just seems like a waste of time. I think we should all voice how we feel about it, but why vote for something that that we have no power to change it? I sound upset, and that's only because I am.
Mr. Urban, Tim here. I think that's what Ms. Freed was mentioning in her initial comments. Am I correct, Chairwoman Freed?
Right. I mean, this is kind of going to the issue that Betsy and I were articulating. PEB's just a little bit strange in the sense that, it's a policy board. And yes, we're fiduciarily responsible, but primarily we do the policy and we don't do the money in the budget process. So this is really how the budget process works. We build a plan design, and PEB submits it as an agency request. And like I said, governors can and do change the budget as they have the right to do. And, the governor retains final authority over the budget, and governors may change the plan design that the PEB board voted on. And so, and the fact that we, and then as Betsy noted, the legislature, evaluates the governor's recommendations and, decides it agrees or does not agree, and then returns the budget to the agencies, and all of us implement our budget. And as Betsy noted, in quote unquote normal agencies, you don't get a say. In turning in my own budget for my own department, I certainly don't expect to have to, have the policy ability to protest things in the governor's recommended budget. I get what I get and I make it work. And PEB's broad policymaking authority is a curious, it sort of clashes strangely with the idea that, the governor appoints all the PEB board members. So in a sense, the PEB board, the governor ultimately retains control over the board in that way. So, I mean, it all sort of leads back to the governor. But again, as I said at the outset, in the second year of the biennium, PEB has historically kind of tweaked plan design because of greater or lesser revenues. And so, and it does, under 287 have the authority to do that. So it's just a really gray area. And, I don't want to minimize in any way Member Urban's frustration. But the way that I sort of holistically understand the law and our job, the governor ultimately retains authority. So,
Laura, this is Betsy. I'm from listening to everything. I know we all have great distress over the long-term disability. I do know that this is the governor's recommended budget, but I do know there's going to be heavy discussion at the legislative level. My understanding is PEB is asking for our permission to move forward, but I'm wondering, we've done this in my past. You don't want to change everything, then have something not pass or pass differently. But with the couple of scenarios we have going, I'm wondering if PEB could move forward and develop a policy plan, something with the elimination of long-term disability, but also keep it there with it, so that, or have a contract documentation to eliminate a contract, but but don't actually move forward on that. So in other words, make things in a queue. Now, I know they're not going to know everything, like is the deductible going to change from 500 to 250 to 5,000, but some of this bigger move. So give them permission to move forward with if this is what occurs. But my gut feel is that this is pretty big and something may change at the legislative level. So I'm just wondering if we prime 2 shoots of action instead of 1, and we ask for that. And I don't know what people think of that. It might be Laura, Rich, good for you to jump in for having 2 possible ways that are legitimately very possible. One, what the governor wants, and one, what may happen at the legislature.
Okay, this is Laura Freed. Let me see if I understood that. Are you basically suggesting a remediation plan by the board if LTD is accepted by the legislature as it is recommended in the governor's budget?
So here's what I thought I heard. I thought I heard Ms. Mooneyhan say that what we're actually, or maybe it was you, Laura Freed, what we're actually approving is for PEB to move forward on these activities, because you don't have much time to make something happen once it's approved. So my suggestion is, can we give them the approval to move forward on these, but also to develop the process, and maybe there's nothing to develop, that if LTD is retained, but it's changed to 50% instead of 60%, move forward on the documents or whatever they would need to make that happen. You can't move forward on every eventuality, but so that there's a couple things in the queue, because I get this idea that if enough people are at the legislature, I've seen them change things, and we've had to pivot really fast. I'm wondering if we can set up 2 processes, and that's what I was asking Laura, Rich, if she thought that was something possible.
So this is Laura Rich for the record. Because of what we have today is what was established in GovRec. As we move through the legislative process, it is very likely that staff will be working with legislators and with the legislative staff if there is a desire to make changes. If that happens, then we would come back likely at the May board meeting and present it again to the board. So I think, Betsy, if I understand correctly, what you're asking is, can we have a plan B? And I think it is, because this is now in the hands of the legislature, it's probably best that that plan B comes from the legislature versus the board.
So Laura, let me ask it this way. You and I talked about on our call, when you called me, and I said when we were talking about the contracts, is it really advisable to terminate a contract when the legislature may turn around and say, no, we want you to keep this benefit? Then you have to turn around and develop a new contract, which is almost impossible to do because it has to go out to RFP, whatever. And you said, no, we're just going to ask for permission to be able to do it, but we aren't actually going to do it. So that's like the plan B on everything we're talking about here. If you need to start a process, but then put it in, shelve it for a little bit till you hear what the legislature says, then we aren't so far down the road, we can't turn back. I think that's what I'm saying.
So I think from my perspective, I think probably the best course of action today is to support the plan design as expressed in the governor's recommended budget, because we are here to serve the governor, and this was essentially what he is recommending to the legislature. Now, moving forward, I can definitely take the board's, the considerations of the board, of public comment, et cetera, as we move through that legislative process, and share that with any of the committees or legislators that may be requesting information about possible options. But I don't know if it's wise to come up with, not only is it not wise, but it's almost impossible to come up with something on the fly during a board meeting. This, as you saw during the November board meeting, this requires a lot of, actuarial consulting, and it's not something that we want to do in real time, because you want to have people that can conduct that peer review and to make sure that everything is correct. So as Ms. Kelly pointed out, yes, we do know that if we wanted to reinstate the long-term disability, it would add about $14.30, give or take, to each employee-only premium tier. And so that employee-only premium tier would go up by about $14.30. That does not align with what the goal of the governor, which was to keep premiums low, and not see any significant increases in premiums for employees and retirees. So my suggestion would be that this now lies on the legislature to make those decisions.
Yes, Laura Tom Verducci. What I wanted to add here is, I see you have 3 items here to be for recommendation, 1, 2, and 3. And 3 reads elimination of the long-term disability benefit. Perhaps that could read retain the long-term disability benefit as approved at the November 2020 board meeting upon approval of the legislators and the GFO. So therefore, if it's not approved, then we sit right where we are with this recommendation. And I think that is viable in terms of protecting Nevada families. And also, if it does not get approved, then it is as it is written and suggested in the governor's recommended budget.
So Tom, by making a motion like that, we are committing the plan to essentially bring back LTD. And that is a little over $9 million of funding that we would need to come up with. So that requires, there are levers. You can, if you need $9 million to fund LTD, you also need to take $9 million from elsewhere, whether that is plan design, whether it's increasing out-of-pocket maximums, whether it is increasing deductibles, whether it's increasing premiums, but you have to find that $9 million somewhere. And so if we were to make a motion and approve it that way, it commits not just the program, but then the legislature, as well. You did mention if the legislature does not approve, then we go back to GovRec. That's essentially what would happen anyway. If the board approved GovRec as it is today, and then throughout the legislative process, if somehow the legislature is able to reinstate the long-term disability, then that would then, if they're able to fund it, they would be able to reinstate it, and it would be brought back to the board in May.
Chairperson Free, can I ask a follow-up question of Executive Officer Rich?
You may.
Executive Officer Rich, we've all been throwing around this number about the cost of the LTD benefit. My understanding is the cost, you just mentioned $9 million over the biennium, that cost is at the 60% $7,500 limit. The board approved in November the reduction of that to $5,000 and 50%, as well as a hard cap at 65. So what is the actual cost of that benefit? It's been 2 months. Do we have a price? What would the premium be for that reduced benefit?
So the premium at the 50% level, I'd have to go back to the standard and ask them to price it out at the 50% level. I do not believe we have that. Carrie, Ms. Eaton, did we get that from the standard at any point? This is Carrie Eaton for the record. I am looking it up because I believe we did. If you give me just 1 minute. Oh, no, I just did the elimination. I did not do the reduction.
Okay, so it's Michelle Kelly again. You know, I would like to see that number, regardless of what we do today. I think it's important for us to be talking about the right number. It surely would be less than the 9 million because it was a reduction. And I thought that when we were doing, when Aon was playing with the figures, it came down to around a bit over $10 per participant rather than the $14. But I do think that I would personally like to see that number. And I think clearly if we're talking about the legislature taking action, then let's have that number ready to go for them as well. But I also have a follow-up for Deputy Attorney General regarding our, I guess, our fiduciary responsibility, because what I heard Executive Officer Rich say was that our loyalty is to the governor and we should pass what he has put in his budget. But it's my understanding we're fiduciaries to the plan. So can you talk about our fiduciary responsibility, please, and what that means?
Thank you, Brandy Mooneyham, Deputy Attorney General, for the record. I might need to do a little bit more research on fiduciary duty. I do know that the board, under the statutes, has the authority for developing the plan and doing so in an actuarially sound manner. It is not a black and white issue. The governor, of course, retains the executive authority, the ultimate executive authority. This is an executive agency. The governor, his recommended budget is essentially a policy document expressing his policy and his thoughts about how the program should be led. But of course, they're distinct but very intertwined, policy and budget. It's hard to carry into effect the policy without the dollars to do so. This board, of course, has authority separate than the governor, but it is an arm of the executive branch. So it's not a black and white answer that you do whatever the governor says. I mean, the board is here to develop the program. At the same time, the governor also has authority and a duty to express his thoughts about the policy as well. And I believe the action that the staff is seeking is the ability to implement what the governor has expressed his policy preferences are. They need your approval to be able to go to implement whatever policy you determine, keeping in mind the governor's recommendation.
Okay. Did I hear somebody else on the board speak up?
Sorry, I was just
Linda
saying.
Fox.
Oh, Linda Fox, you haven't weighed in. Thank you.
I have a couple comments. It seems to me, I guess my question is, do we have to take any action today? So if I understood the clarification from Ms. Mooneyhan, it's out of our hands at this point. And the board already made a recommendation. So I'm just wondering if we have to take any action today. And I do understand the importance of getting comments on the record, but do we have to take an action today?
I believe based on Ms. Mooneyhan's guidance, we do have to take an action today. Ms. Mooneyhan, do you agree? Can you confirm?
Legally, I think if I understand the staff's recommendation is they need approval to proceed with the next step in designing the plan. They need the board to give them the authority to proceed with running the calculations and designing the plan congruent with the governor's recommendation. They, right now, and I mean, maybe Ms. Rich can speak to this, maybe this is more of a policy pragmatic question than a legal question. Right now they have the board's instructions from the November meeting. They also have the governor's recommended budget, and they're asking for your approval to be able to proceed to make those changes to be in line with the governor's recommended budget.
Additionally, the March board meeting will require rate setting. In order to do rate setting, plan design needs to be approved. A certain plan design needs to be approved. And so notwithstanding a motion today, my assumption is we would have to move forward with pricing out the plan design based on the governor's recommended budget.
So this is Betsy, and I have a question. So we give approval to go forward with the governor's recommended budget, but there's significant changes in the legislature. Then that's where I was trying to go, was saying that if you can foresee some expected changes, maybe you start working that way too. But short of that, then you'll have to put a screeching halt on some of the changes you've been making and pivot really quickly, correct?
That is correct.
Okay. This is Laura Freed. So I'm going to put a motion on the floor, and I make this motion because I want to enable PEB staff to crunch the numbers for the March rate setting meeting, and develop all the eventualities they need to enable our easier decision making in March. I am going to move to approve the staff recommendation so that PEB staff can go forward planning for a rate structure predicated on the recommended budget by the governor.
Tim here, I'll second that.
Okay. Any questions on the motion? Okay.
Kelly here.
Yeah, go ahead.
I would just like it on the record that I think this is premature. I think that there's too many unanswered questions. And I believe that an endorsement by the board on this plan design is premature. I don't think we've discussed it. I don't think it's our plan design. And I believe we have a fiduciary duty. So what I think staff should move ahead with designing the two rate structures, one as government rec and one with LTD included back in, and provide that to us in March.
Other comments, questions?
Tom Verducci, for the record, I would concur with Member Kelly's statement. I think it's important to have two plans in place and be looking at other alternatives as opposed to a complete elimination of the LTD.
Okay.
This is Jennifer Krupp. Just a quick question. If PEB staff does do the development of two different plan designs, really, like, the plan design that would be based off the board recommendations made in November wouldn't be applicable anyway, correct, due to the GovRec budget? So we'd essentially be asking PEB staff to do a plan analysis that we wouldn't have any ability to implement regardless. Is that true?
I think that is correct, but I'll let Laura Rich say yes, no.
Thank you.
That is true. That is correct.
Okay. I'm going to call the question, and then if board members want to make other supplemental motions, I'm certainly happy to entertain those, but I'll take one thing at a time. So again, the motion was to accept the staff recommendation, and it was seconded. All in favor signify by saying aye.
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 Jennifer Krupp, aye.
Okay. Opposed, say no.
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 Sorry, it's just too premature.
Okay, so I've got Mr. Verducci, Ms. Kelly, and Ms. Urban as no's. Did I hear any others that I missed? Okay.
I would like to make a supplemental motion if the chair will indulge me.
Sure, go ahead.
I would like to make a motion that the staff price out the long-term disability plan that the board approved in the November meeting, so the reduction, and bring that back to the March meeting, showing us how much the LTD, to continue the LTD at the reduced amount would cost for the premiums.
Marcia Urban, I second that.
Okay. We have a motion and a second. Members, do you have questions, comments on the motion?
I have a question, Linda Fox. What would be the cost? This question is for Laura Rich. What would be the cost of pricing that out?
Are you asking what a vendor would charge us to do that?
Yes.
So adding it into rates is pretty simple, and that would not come out at a cost. If we were to incorporate that into plan design and somehow try to work in the, let's say it's $8 million, work that into plan design by adjusting different levers, whether it's reducing HSA or increasing deductibles or anything like that, then yes, that would come at a cost, because that would require the actuaries to get involved. But if it's just tacking it on to the premium at the end and just having that flat addition to the premium, then that's a fairly simple process.
And just to clarify, it's Michelle here. So I'm not asking you to build it into any price or redesign any plan. I'm just asking, what will the standard charge us to cover every employee at 50%, up to 5,000, with the age at 65. So the things that we approved at the last board meeting. I just would like to see the cost.
This is Betsy. That's probably likely a question that might come from the legislature. Just don't know, but seems like if it's prepared, it'll be a lot easier for you to answer that question. I'm just guessing they'll ask that.
Okay. I think then if everybody understands the motion and nobody has any other questions, I will call the questions. All in favor, say aye.
Tim here, can you repeat the motion and a bit more clarity from?
I will try, and Ms. Kelly, please jump in if I don't get this right. So the motion on the floor is to request that PEB cost out the additional participant share of the premium to go back to the LTD benefit as we approved at our November meeting. So 50% benefit. Do I have that right, Ms. Kelly? You're on mute. You're on mute. You got to start over, unfortunately.
Sorry. Sorry. So yes, kind of right. I mean, whether we get the premium at the participant level or just as what the standard's going to charge over the biennium, just really that number is fine. We've been talking about 8 million, 10 million. So how much will it actually cost for that reduced benefit? Yes.
Tim here for the record. So that's kind of just an informational motion, like let's get some information. And as Ms. Aiello said, it would be presented to the legislature. Is that the intent, or is that what I'm understanding?
I think you're right. Yes, it's informational item for us. It's more than likely the legislature may want to know that number, but I think that we should know that number too.
I'll say more information is better. As an information, yeah, for information, I'm okay with getting more information.
Right. I mean, yeah, we can certainly. Right. We don't necessarily need a motion in the sense that, I think Ms. Rich would be happy to find that. But I mean, if it makes everybody feel better, we can certainly take action on it. So with that.
One more question, Ms. Mooneyhan. Does this impact any of the open meeting law?
I believe a question like this is contemplated in the agenda item, so I do not think that it violates open meeting law.
Just want to be sure. Thank you very much.
Okay. With that, all those in favor of the motion on the floor signify by saying aye.
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 Any opposed, say no. I'm a no. Motion carries. All right, with that, have we chewed up item 5 well enough, folks? Okay, let's go to item 6, unless everybody would like a break.
We have a request for a break.
Okay, great. It's 11:30, so we'll come back at 11:35.
Thank you.
All right, everybody, it's 11:38. Let's call this PEB board meeting back to order. And staff, if you're ready, why don't we move to agenda item 6 and talk about contracts?
Thank you. Carrie Eaton for the record. Item 6.1 is just an overview of the current active PEB contracts. I'd be happy to answer any questions regarding this. However, this item there's no action necessary. I will move on to item 6.2. Item 6.2 is requesting that the board approve new contracts resulting from solicitations that the board approved for an in-state PPO network, an HMO provider, and a statewide dental network on May 28, 2020. The first new contract in item 6.2.1 is a contract resulting from the in-state PPO network RFP that was released on August 21st. On October 8th, PEB received 5 proposals in response to the RFP. The evaluation period began on October 8th and ended on November 3rd. The 6-member evaluation committee included 3 PEB board members and other subject matter experts. Aetna signature administrators received the highest score by the evaluation committee, and PEB has successfully negotiated a contract. This contract is expected to save approximately $4 million in network discounts, and it expands the network to include St. Mary's and Banner Memorial Hospitals. There will be minimal disruption for most members. However, members using Southwest Medical Associate providers will see a disruption unless they decide to migrate over to the HMO plan. The effective date of the contract is anticipated to be February 9th or upon BOE approval through June 30th, 2026. These services are expected to begin on July 1st of 2021, and the maximum amount of the contract is $7,127,250. Staff is recommending that the board ratify and approve the evaluation committee's recommendation to the contract with Aetna signature administrators, and I am happy to answer any questions.
So this is Laura Freed for the record. I think what I want to do here is have Carrie go through 6.2.1, 6.2.2, and 6.2.3 with her presentation. And then if any member wishes to close the meeting, we'll do that at the time rather than just going in and out and in and out. That doesn't make sense to me. Okay?
Will do. Carrie Eaton again for the record. The next new contract in item 6.2.2 is a contract resulting from the HMO services RFP that was released on September 4th. On October 13th, PEB received 2 proposals in response to the RFP. The evaluation period began October 14th and ended on October 27th. Health Plan of Nevada received the highest score by the 6-member evaluation committee that included 3 PEB board members and other subject matter experts. Since Health Plan of Nevada is PEB's existing HMO vendor, there will be little to no impact to the program or to members. The effective date of the contract is anticipated to be February 9th upon BOE approval through June 30th, 2025. Services will also begin on July 1st, 2021, and the contract maximum is $192,093,848. Staff is also recommending that the board ratify and approve the contract with Health Plan of Nevada. The final new contract in item 6.2.3 is a contract resulting from the dental network RFP that was released on September 11th. On October 15th, PEB received 7 proposals, and the evaluation period began October 16th through November 10th. Diversified Dental received the highest score by the 6-member evaluation committee, and there were, I believe, 2 PEB board members on this evaluation committee. And since Diversified Dental is PEB's existing dental network provider, there will be little to no impact to the plan or members. This contract will also go to the February 9th BOE, and the contract will go through June 30th, 2026. This contract maximum is $1,601,613, and staff is also recommending that the board ratify the evaluation committee's decision. And I will be happy to answer questions now.
Okay. Board members, do you have questions on any of these new contracts?
It's Michelle Kelly here. I have questions on both the statewide network and the HMO.
Okay. Please proceed with your questions.
Okay, I wasn't sure if we needed to close. So
I'm sorry to interrupt you. I think it kind of depends on how detailed the questions. So we'll hear the questions, then we'll decide if maybe that needs to go into closed meeting.
So on the network, I'd like to get a better understanding of what the disruption was and what the analysis was. I think, so obviously we've heard one provider network's not included, but Kerry also said it was minimal. So I'm somewhat confused. So I'd like to actually discuss the disruption analysis in full, if that's possible. And then on the HMO, I'd also like to talk about that. I would like to understand what guarantees have been built into the contract as far as access to primary care providers. I would also like to understand if the two proposals were viable proposals, given that, you know, I hear that HMO in the South is viable, but that's not the feedback I get from many employees who are in it. So, so those are my questions.
So this is Laura Rich. I think most, if not all of those, will be done in a closed session. Since even discussing the disruption, there would be a comparison between different vendors, and a lot of that is confidential from my understanding. So we will have to close it down to the public.
This is Laura Freed. Okay, so I'll let the PEB staff kind of go into the any more technical details, but let me give you an overview of how the process is going to work. We're going to have to leave this Zoom meeting and then get another separate Zoom invitation just for the board and PEB staff, and then we will do our closed meeting, and then we will come back to this meeting. And so I assume that we will be shortly getting emailed our special closed meeting links, and then I will close the meeting for an hour, and then so to give everybody plenty of time to speak freely in closed session about these three contracts. And then we'll come back and open the meeting back up to the general public. So that's how the process is going to work.
Madam Chair?
Yes,
may I make a record about the closing of the session?
Yes, of course.
Okay. Just for the record, I wanted to note that NRS 287.04345 subsection 4 provides that the board shall review any, the board reviews any results of the evaluation of the proposal, has to be done in a closed meeting, and that NRS 241.016 subsection 3, that's in the chapter regarding open meetings, it recognizes that the provisions of NRS 287.04345 prevail over the general provisions of the open meeting law. I'd also like to note that this is consistent with NRS 333.335 subsection 7, which provides that proposals are confidential until a contract is awarded. And I would like to note that this closed portion of the meeting will comply with other provisions of the open meeting law. The meeting will be closed only to the extent set forth in the statute. That is only to review the results of the evaluation of the proposals received. The closed portion of the meeting will be separately transcribed, and separate minutes of the portion will be taken. And pursuant to NRS 287.04345 subsection 5, any award, cancellation, or modification and reissuance of the RFP will be done in the open when the board is back in an open meeting on the record. Thank you.
Thank you. Understood. Okay. So
unless PEB staff tells me I'm wrong. Everybody just stand by, please.
Can I just, it's Michelle Kelly here, just a question as far as process goes. When we go into the closed meeting, should we close down our primary windows, as in shut this Zoom meeting and come back in later? Yes, okay. I was going to mute and put everything down, but I just wasn't sure if we should shut everything down.
Wendy or Steve, do you have anything to add to what Chair Freed just said, if you want to just clarify?
No, that was
Go
all
ahead.
correct. I'm sending out the invitations here. You should have them in a minute. And you want to be sure to actually leave this meeting.
Yeah, exactly. Just absolutely, leave this meeting and then you'll be starting a new separate session on the new invite that Wendy sends you. And this meeting will not stop. There'll be a slide that comes up to advise anybody watching that it's on a closed session.
So Chair Freed, do you want to establish a time then? It's 11:50. Do you want to maybe just make it an even 1 o'clock when we are scheduled to?
Yes. I'm sorry, this is Laura Freed for the record. Yes, consistent with my desire to give the board about an hour. Yes, we'll close the regular business meeting till 1 p.m.
I do have 11:45 on the invite, but that's fine. Just come back at the new one at 12.
Okay, so I think we can all leave and join the new meeting when we get the invite in just a minute or so.
Hello, is everybody back?
Bertucci, I'm here.
Thank you. I see everybody coming back online.
Laura, I think Jennifer may jump in here, but Jennifer, do you still have to leave for your own board meeting? You're on mute.
Thank you. No, I let everybody know that I'd be participating in this one because I wasn't sure how long it would go. I do have to stop at 3 though. So.
Okay. I will do my best to get us out of here by 3 o'clock.
Thank you. I'm just going to go run and grab my tea really quick and then I'll be completely ready.
So everybody, are we ready to rejoin the regular meeting?
I don't see Tim yet.
Oh, okay. I'll hang tight.
I just messaged him too, and I haven't received anything back, so hopefully he's joining. Looks like he is on.
Okay, I think we've got everybody. So PEB staff, are we broadcasting? Can I just call it back to order?
Madam Chair, yes, we are live.
Great. All right, everybody, it is 1:03 p.m. and we are calling the regular meeting back to order. And we are still on item 6.2 of the agenda, new contracts, and we have gone through in closed session all the questions board members had on these three. So I would accept a motion to approve all of these three contracts to move forward in the process and accept the evaluation committee's recommendations in all three cases.
Michelle Kelly for the record, so moved.
Great. Do I have a second?
Tim Lindley seconded.
Thank you. All in favor, say aye.
Aye.
Aye. Any opposed, no? Okay, thanks. Okay, let's move on to the amendments.
Thank you, Carrie Eaton for the record. Just to clarify, would you like me to stop after each contract or continue with all three and then make one motion?
I think I would prefer to have you go through all three, and then I think we'll make one motion unless the board members have some heartburn with one of them.
Okay, I will proceed with all three. The first contract amendment is item 6.3.1 with Hometown Health for PPO network services. This contract has been amended and extended and has never increased authority from the original negotiated contract that began on July 1st, 2014. When the contract was amended to add the EPO plan for plan year 19 through plan year 21, authority was not increased to the contract for the increased population, as it appeared there would be sufficient authority at the time. This contract amendment is required to add additional contract authority in the amount of $526,710 to fulfill our contractual obligations for the remainder of the contract term through June 30th, 2021. And the next contract amendment is item 6.3.2 with the standard for basic group life insurance and long-term disability services. This contract amendment is required to amend the fee schedule to align with the plan design changes included in the GovRec budget. This amendment will include a reduction to the maximum contract authority in the approximate amount of $16 million. The reductions would be to align the $15,000 active coverage, $7,500 retiree coverage, and the elimination of long-term disability. With this one, I do want to note we probably could hold this. If it's approved by the board, we could hold it until a May BOE or something like that. So I'll go on to the last one. Item 6.3.3 with Aon Consulting for actuarial and consulting services. HEB has two major RFPs for a TPA and a PBM to release in the near future, excuse me, that will require consulting services from Aon for their expertise in the development and analysis of the RFPs and their responses. Due to an unanticipated amount of utilization in consulting services related to COVID-19 costs, budgeting activities, and all the solicitations that we've had to complete, HEB does not expect to have sufficient contract authority to be able to enlist the services necessary in these major contract renewals. So we are requesting an additional $225,000 in the contract authority. This additional authority will also require a work program from the board, and the Board of Examiners approval would likely be contingent on the approval of that work program from the Interim Finance Committee. So that is all of the contract amendments.
Tom Verducci for the record. Carrie, I just had a question regarding these changes here. Are these items that we've already budgeted for in our current budget, or how do we reflect these additional payments that we're going to be making? How does it fit into our budget?
Thank you, Carrie Eaton for the record. Yes, for the most part, these contracts are budgeted for, but the additional increase in authority has to come from somewhere. So we would find funds from not utilizing, say, travel or things like that, or if we see a reduction in another cost somewhere, we could use those funds. If we are anticipating a little bit of excess reserves, we could also use that.
Okay. And just as a follow-up, you had also mentioned perhaps holding the standard update on their contract. Could you expand just a little bit more on that? I want to be able to understand what was said there.
Yes, Carrie Eaton for the record. So we bring all of these contracts to the board for approval to complete the process, to actually, there's a time frame that all of these have to go through. So these are like the would have to go to the Board of Examiners for approval, and there is deadlines to get them there. So right now, if we completed this contract amendment, the earliest to the Board of Examiners would probably be April or May, just because of deadlines. So we could hold it for the May Board of Examiners meeting, just in case there's anything that happens during the legislative session that would allow us to adjust the amendment before it's approved.
Based on what we approved in item number 5, does it look like it makes sense to delay 6.3.2 on the standard to see if there's any changes in the LTD?
It's Michelle Kelly for the record. I would be supportive of that motion, Tom. I think it's premature to be modifying this contract, especially after all the conversation around this item in question 5 about the, legislative action potentially and stuff. So I think it's too early to be modifying that contract yet. So I would be more comfortable if it came back at a subsequent board meeting.
This is Board Member Jennifer Krebs for the record. Regarding item number 6.3.2, the standard contract, when are those contract authority changes set to take effect? Would those be for state fiscal year 22 and the upcoming budget, or are we talking about changing that contract authority right now for fiscal year 21?
This is Carrie Eaton for the record. The actual contract changes would be effective July 1st for fiscal year 22.
Thank you.
This is Laura Freed. Okay, one question about the Aon amendment. You mentioned that there would be a work program. Would that be going to the March IFC, or is it even IFC qualified?
This is Carrie Eaton for the record. I believe we would try to get it to the March IFC. There's not a schedule out yet, so
Right. Okay.
Sure when the deadlines are.
Okay, got it. All right. Well,
This is Betsy. I have a question actually with the standard contract.
Okay.
It just because the contract authority is inside the contract, until you spend it, you don't pay it. So would there be a problem to hold that to see what happened in the legislature and change the contract authority a little bit down the line versus before the fiscal year starts? I mean, is there an implication? Because I would hate to amend this contract and turn around again and have to undo it. And I don't think the money, I don't think you always spend all contract authority that's in there. I do know they need it for their budget, but I'm just wondering if there's any administrative problem from holding it a little.
This is Carrie Eaton. More so is the fee schedule that's included in the contract. So the fee schedule is the specific amount that we pay the standard each month based on the offerings that we agreed to. So the offerings and the costs that are in the current contract would not be correct.
Okay.
Okay. Because that was confusing me with just the contract authority thing.
All right, so this is Laura Freed. I, based on that discussion, and in view of our, waiting to see what the legislature thinks about item 5 of this agenda, I would accept a motion to complete the contract amendments for 6.3.1 and 6.3.3, and then not take any action at this time on 6.3.2. Does that sound okay?
Tom Verducci for the record, so moved.
Okay, do I have a second?
Michelle
Yeah.
Kelly for the record. Oh, someone, Tim.
Jennifer Krupp, I'll second.
Okay, great. Thank you. All right, all in favor signify by saying aye.
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 Aye. Any opposed, no? Okay, great, thank you. So let's move on to 6.4 contract solicitations.
Okay, so I will take this part. This is Laura Rich for the record. We do have many contract solicitations that will need to be presented to the board. This is not an all-inclusive list. These are just the ones that we need to get moving on quickly because of the timing involved. So the first one is the website hosting. So in 2015, PEB contracted with KPS3 for website development and hosting. And we used an existing contract joiner with DCNR. That contract is expiring on June 30th, 2021. And so PEB will need to go out and solicit for ongoing website hosting and maintenance moving forward. This is expected to be a very, very low cost solicitation, obviously, in relation to all of these other ones. We're looking at $1,660 a year for these services. And so this is going to be an informal solicitation. It will not include an RFP. And for those of you who are not familiar with the informal solicitation process, this is a much less complex process to elicit bids from different vendors. So the recommendation here is to allow staff to complete an informal solicitation for website hosting and maintenance services. And I guess I should clarify, based on some discussions in previous board meetings, or maybe this was the subcommittee meeting, I can't remember now. This is the PEB website, not the enrollment and eligibility site, which is much different. So I'll pause there.
Okay, I think I will let you go on to 6.4.2 in that case.
Okay, so this is a much larger and much more complex solicitation. So PEB's current contract for TPA services is with HealthScope Benefits. That began back in 2011. And that contract has been amended 6 times, extended twice, to add a total of 6 years to that original contract. But it is now due to expire on June 30th, 2022. Currently in the TPA contract, there's a lot of services that are rolled into that TPA contract. So you see services such as Doctor on Demand and Healthcare Blue Book. Those have all been offered through HealthScope and through amendments. So those services no longer, those are going to have to go out to solicitation as well. Being that this contract expires on June 30th of 2022, and it is such an enormous undertaking, it is very important that we get a move on this quickly. And so this is why it is being brought to the board today, so that we can start looking at exploring the options and really getting the wheels in motion so that this RFP can hit the street, hopefully in the summertime. The earlier, the better, in my opinion. So if you look at the grid on the bottom of page 8 there, I've lined out the different services that are either contracted separately through HealthScope or that are included in the HealthScope contract. So typically, for those of you who aren't familiar with what HealthScope does, they are our third-party administrator. They essentially pay our claims. And then they also manage all of the processes behind the scenes. So all of the accumulators, member accumulators, they also have a call center that will address member questions, and they're the ones who are quoting all of the benefits, right, to members. And so it's a pretty significant service. They do this on the medical side. And then they also, with that, have a dental network attached to the TPA. And then they also have a national network, which is currently with Aetna. So we just spoke about an Aetna contract that for the statewide contract, HealthScope is already associated with Aetna and has a contract with Aetna to offer PEB services nationwide. So typically with a TPA, they come as a package deal. So the TPA with a network. And as part of that package deal, you tend to get better pricing through those solicitations. And so because they come with their own networks and they already have partnerships and they get volume pricing. So it's being recommended here that not only do we have the medical claims, the dental claims, and the national network be rolled into the TPA contract, but also include an option, even though we have just awarded a contract to Aetna for a statewide network, include this when we go out to RFP, include an option for a statewide network as part of the TPA contract. When we include it as an option, that allows us to do a cost comparison and again, a disruption analysis and look at, are we getting a better deal? If it comes as a package deal, because typically organizations do not go out and RFP separately for networks. We are a little bit of an anomaly. We're the exception. Usually all of this comes as a package deal. So that is the bulk of that TPA RFP. In addition to that, we have the telemedicine provider, the shopping comparison tool, subrogation, and second opinion services. So with the exception of the subrogation, the telemedicine provider, shopping comparison, and second opinion services, the recommendation here is to go out to bid separately for these services, but then have that winning vendor, that contract lies with the winning vendor, sorry, I can't talk today, with the winning vendor, and have them contract directly with that TPA. So what we accomplish there is transparency. We've got all of these sub vendors that are offering services. So for example, today we have Healthcare Blue Book, right? So we would go out to bid, and that accomplishes transparency. We have an evaluation committee, they select a winning vendor, and then at that point we negotiate a contract, and then we say, okay, TPA, here's this contract, we need you to put it into motion. And then that way it is not a contract that PEB has to manage, but at least we accomplish the transparency piece of that. The outlier here is subrogation. Subrogation typically is included as part, again, of a package deal with a TPA. They typically have, the industry standard is for a third-party administrator to have a relationship with a firm that conducts subrogation services. That is the norm. The recommendation here is that we can go either way. We can include it as the TPA in the TPA solicitation or go out to bid separately. Going out to bid separately would be a little bit outside of the norm. However, we in the past have had relationships with our subrogation firm through our TPA. And in looking through some of the history, the recoveries from those subrogations were fairly low. And then we switched over to a new, well, when I say we, it was HealthScope, switched over to a new subrogation firm. And those recoveries are now almost triple what they used to be. So it's something that, although is outside of the industry norm, it's something that the board could choose to do. I think either way here is acceptable. And then we have the FSA administration. So right now we have that as a separate contract through HealthScope. It's a $0 contract. And so HealthScope offers FSA, and what they do is they charge an administration fee. They charge a $3 administration fee for those folks who want to participate on the FSA. And that's a flexible savings account. I'm sorry, didn't say that. So it really makes no sense for PEB to go out to bid and have a separate solicitation and contract for this when it can easily be offered in the same manner as a voluntary benefit on the voluntary platform. So the recommendation here is just to offer as a voluntary benefit. The administration fees, from what I've heard from the vendors, are about the same, $3 to $5 to administer that FSA through a voluntary benefit. So then the last one is the HSA and HRA administration. Right now, we again have that through HealthScope. And the recommendation here is to go out to solicit for this separately. So to wrap it up, when I say that PEB staff are going to be busy as well as purchasing staff, I am not saying this lightly. There's going to be a lot of work ahead of us. And this is, like I said, not inclusive. There are going to be a lot of RFPs ahead of us that we haven't even brought to the board yet. So I will stop there because there's a lot of information that I just went over. And unless you want me really quickly to cover the PBM, I think that's a little bit, shouldn't be as complicated. But or if you want me to stop right there for questions.
I have a quick question.
Yes.
This is Jennifer for the record. So you kind of already answered my question about what would be the benefit of doing a separate solicitation or continuing to keep the solicitation for the subrogation in the TPA contract. But I'm just kind of curious, like, what PEB staff's opinion would be and whether or not the maintenance of a separate contract or keeping that as a subcontractor on a larger RFP would be. And then the other question that I had was if in the HSA/HRA administration as a separate solicitation, if we could include a provision for the FSA administration in that RFP, or would that increase the contract costs? So two separate questions, kind of a lot. Let me know if you need me to repeat it.
So for the subrogation, it can go either way, right? So yes, it is a lot more work to maintain another contract. And if you recall, those on the board that were around a couple of years ago when we moved a lot of services over to the voluntary. So all of our voluntary products were moved over to the voluntary platform. And the reason why is because we were trying to reduce the amount of contracts that we had to manage. As you know, we're 34 staff, and that's if we're fully staffed. And there's not a lot of expertise when it comes to, or a lot of staff time that can be dedicated to all these contracts. And then especially if you have to go out to bid and et cetera, et cetera. So maintaining contracts is something that we would like to avoid as much as possible. But we still want to make sure that we're transparent. So we still have to go through the solicitation process. On the flip side, like I mentioned with the subrogation, and I can put numbers to this, back in the day, and I can't remember what year it was, but we were collecting in recoveries about $400,000 in subrogation recoveries. Whereas we're looking at now with our current vendor through HealthScope, it's over $1 million now. So they've already established relationships with law firms throughout the state, right? So when they go and they proceed with those recoveries, they reach out to those law firms, and they're a lot more effective because they've already maintained those relationships. And so having that, the ability to, I guess, to go through a solicitation and see, how successful has this company been versus just taking the package deal, right? But sometimes taking that package deal, you're already getting, a better service, which is why that is industry standard. So you can go either way on that one.
So, Laura, I have a couple questions. One, I'll just piggyback real quick on that subrogation one. If, as part of a package deal, though, we could still require them to have vendor presentation and contract standards for that sub area, I would think, and then that would be more. So if you got 4 RFPs for different TPAs as part of the RFP and the selection, it could go over, but that's just a thought there. But I wanted to clarify. So right now, where you're saying the statewide network, it's a separate contract. And it starts on the this July. So the TPA wouldn't start till a year from this July. So we might end up if we move that into the TPA, we may end up canceling that contract after a year and moving, because I am a fan of making, you don't really have enough staff for the amount of contracts you have. I totally agree. But so I just wanted to clarify. So that would end that one standalone contract and it would become part of the TPA. Okay.
Correct.
And my mind had been going along very much the same as Jennifer's, wondering if the FSA would easily slide into the HSA, HRA activity. But that was just a thought I had, and then Jennifer mentioned it also.
This is April. Just to kind of jump on what Betsy said, with regards to that scenario, if we were to cancel that contract early so that it would be part of this renewal, are we looking at any type of penalties associated with canceling that contract?
No, so typically you have an 180-day out period with contracts. And so as long as we did it within those 180 days, we'd be fine.
Okay, thank you.
It's Michelle Kelly here. Executive Officer Rich, so when you release the solicitation, is it kind of like a cafeteria that you'll put out kind of looking for a contract for TPA for one or more of these activities? So can it kind of be optional, or do you have to separate them? I know in my world, I can put them together and offer respondents the chance to bid on all of it or just a piece of it or whatever, and then we do the jumbling.
So you can do it that way, but then you don't have the ability to. So let me back up. So a third-party administrator can have already standing relationships with, for example, telemedicine. So HealthScope has a standing relationship with Doctor on Demand. And again, they can come as that package deal, but maybe Doctor on Demand doesn't fit our needs. Maybe it's not good for PEB. Maybe it's, we want options. And so that is why the suggestion here, the recommendation, is to solicit for a telemedicine provider so that we can evaluate each of those services. We can certainly say, if you have a relationship with a telemedicine provider, who are you, include that in that RFP and make it a question in the RFP for the TPAs to respond with, but then you're only getting usually their, the one established relationship. So this just gives us a little bit more flexibility. And as much as I don't want to go out to bid for all of these extra services, I think that it is prudent for the program to do so.
Thank you.
And Laura, so are you thinking that each one of them would be a new contract, or would they be going together, like second opinion and telemedicine and shopping comparison, or they'd be 3 additional contracts?
That is correct.
Okay, this is Laura Freed. If there are no more questions about 6.4.2, I will have you go quickly to the Terms of Benefit Manager, 6.4.3.
Okay, so the Pharmacy Benefit Manager, currently our contract with Express Scripts, who is our PBM today, began in 2016. And since then, the contract has been amended 4 times. Generally, this is because of the market checks that we have conducted on ESI every year to lower those negotiated fees. So the original 4-year contract was previously awarded, and then a 1-year extension was awarded as well. And so that is now also due to expire on June 30th of 2022. Again, this is a pretty significant RFP. If you have ever been on the evaluation committee for this, both the TPA and the PBM, they are pretty significant undertakings, and it's a lot of work for those evaluators. And so both of these are very, very significant, not just to develop the RFP, but to evaluate the RFP, to negotiate that contract. These are very, very significant undertakings for staff. So this is why we are bringing them to the board sooner rather than later. The other important thing here is that, unfortunately, the 2 most significant member-facing vendors that we have, with the exception of the enrollment and eligibility platform, these are the 2 most significant vendors, and this is what our members deal with every day. They're either dealing with HealthScope or ESI, whether it's a medical claim or a pharmacy claim. And so this is going to be big for members. This is going to be a significant change if we change our vendors through this process. This next open enrollment is going to be not fun for staff and for members, and it's just going to be a lot of change all at once. And so this is going to require a lot of planning, a lot of communication, a lot of technical implementation and undertaking. Everything we do runs through the TPA or through the PBM. And so I know Chair Freed, you just sighed. I feel the same. This is going to be very significant for the program.
Laura, when you're talking about combining some things, is there plus or minuses to putting the PBM in with the TPA?
So the PBM is essentially a TPA for pharmacy. So it's separate, it's different, it's a different service. You'd have to.
Okay, but you have the medical and the dental together. So I didn't know if for the philosophy of integrated care, the pharmacy would fit well with the medical and dental as one.
April Karn, real quickly, with regards to going out for RFP for a new PBM, are you looking at continuing to keep specialty pharmacy under that PBM, or are you looking at branching out and possibly soliciting a separate vendor for specialty farm?
To be honest, we have not gotten that far yet, because that is the next step in the process, is to look at what are the options? What are the options out there? How are we going to proceed with this RFP? And this is actually something that I believe those board members who are interested in participating on a solicitation like this may want to, get involved early and get involved in not just in the evaluation of the solicitation, but also in the development of the solicitation. So the next step, and we will be working with, as you heard earlier, where we are asking for increased authority for the Aon contract, so that we can tap into their SMEs who do these RFPs day in and day out. And so they have those expertise that they can provide. They have, they have the guidance and advice that in-house staff at PEB do not have. And so we are really going to need to leverage the experts on this.
Okay, thank you.
This is Laura Freed, having trouble unmuting myself for some reason. All right, we'll do the easy one first. I will accept a motion to authorize PEB staff to complete an informal solicitation for web hosting under 6.4.1.
Marcia Urban, second.
I didn't get a first.
I'll take a first. Then I'll do the first.
Okay.
But you have to state it.
I'll do the second. This is Linda Fox.
That sounds great. All in favor, say aye.
Aye.
Aye. Okay, great. Okay, let's do 6.4.3, pharmacy benefit manager. Do I have a motion to authorize PEB to move forward with a request for proposal for a new pharmacy benefit manager?
This is April. Oh, this is April. I'll go ahead.
I'll take April's for that motion. Do I hear a second?
Michelle,
Second.
Yes. Okay. I've got a second from Michelle Kelly. All in favor, say aye.
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 Thanks, guys. All right, so now 6.4.2. All right, so we had a little discussion about subrogation, whether we should include it in the big RFP or do a separate solicitation. Board members, how do you feel?
This is Jennifer Krupp. I don't know so much how I feel about doing a separate solicitation or doing a subcontract with the regular TPA RFP. But the one thing that I did really want to emphasize that we do is that we do put maybe perhaps performance standards in there, as I think was a board member, Kelly, I can't remember who suggested that, but if we do put like significant performance standards within the contract, I think that would be a good protection, since this can really assist the agency with revenue. So.
And this is Betsy. I agree with what Jennifer said. And I'm just truly would ask the PEB staff, if you move the telemedicine out, you move the shopping comparison out, and the second opinion out, it may be more than the ability to oversight and to follow some of those performance standards closely, to move that out as a separate one also. But I have no great feelings either way, other than is it a functional workload?
Yeah, I agree with that. I think given the constraints that you have with regards to staff, you might just really need to really consider that, because it is a lot of additional extra work to have all of these split.
Okay, this is Laura Freed. So I'm hearing that everybody's comfortable with staff recommendation, except on subrogation. The preference is to include it in the TPA solicitation rather than having yet another separate solicitation. Okay. All right, I'll make that motion. Second?
Linda Fox, I'll second the motion.
Okay, great, thank you. All those in favor? Say aye.
Aye.
Aye. Aye. Any opposed? Okay, great. All right, that is, I think, it for 6.4. PEB staff, did you want to cover 6.5, or is this just informational for the board's edification?
So this is just informational. It's just to show where we are at with the status of the remaining solicitations that are out there right now. We have the health plan auditor, which is already in the negotiation process, and the financial auditor, which the RFP has been released, and but it has not. The evaluation committee has not yet met, and so. That should be the anticipated actual notice of intent to award will be in early to mid-March for that one. So you should see the health plan auditor come to the board at the March board meeting, and the financial auditor come to the May board meeting.
Okay, thank you. With that, we'll move to agenda item 7. Ms. Rich, you're on mute.
Sorry. So I wanted to give some brief background before Ms. Messier jumps in. Today's Aon presentation really serves two purposes. The first is to provide the board a more in-depth understanding of the rate setting process. But the second is to address an issue that has come up as a result of the rate setting process that occurred last year. So those of you who are around in March may recall that there were some concerns about the increases in rates and how each tier was affected. So during that rate setting meeting, the board made the decision to veer from that standard formula, and some adjustments were made to that. So since that was really a one-time decision and not a policy change, if we don't address this today, then the employee plus child tier will that's potentially the single parents, will this year experience a disproportionate increase in rates. So PEB has asked Aon to present options that may help mitigate this issue. So I will pass it along to Ms. Messier, who will then go through her presentation.
Thank you, Ms. Rich. Hope everybody has their thinking caps on as we walk through rate setting. Let me share the screen. That's probably a little bit easier for folks. Are you able to see it? I do have two monitors, so I just want to make sure it's doing okay. I see Chair Freed has given me the thumbs up. Thank you very much. All right, so rate setting is our first section. And unfortunately, we have to continue to give these warnings. I wanted to use as close to real numbers as possible, but given we've probably produced about 60 different versions of rates so far this year. And as we learned earlier today, there's still some heated debate about what the plan design might look like in March. So therefore, for the sake of this illustrative walkthrough of rates, I did still include an amount of long-term disability that was kind of the prior amount. I did kind of use some base rates that were not quite what we're seeing so far. So anything that you're seeing today, if you take a screenshot and then compare it to what we present in March, I can guarantee you 100% they will not match. These are not the rates that you are going to see in March. They are, however, directionally correct, relationally correct, so that we can have a good discussion on rate setting. But I do not want anyone to come away from today saying, Aon said our rates are going to be X, because absolutely not what I'm saying. I apologize for having to give that disclaimer, but I think it's important. Okay, so as we mentioned, we're going to focus our first half of the presentation really just walking through the different steps that we go through in setting your rates. And then where we need more active participation is on the second half of this section of the agenda, is to really talk about what is happening on the dependent side, as well as another fun element of budget setting with 2 years of plan included in one budget. There is a larger impact that happens in year 2 of the biennium that we wanted to walk through as well. And then we are putting a star in places where enrollment weighting matters. And I'll get to that when we see those stars, but that's just something for you to watch out for as to why the folks at home that like to take numbers and walk through them, it's not always as simple as A plus B equals C. It really does matter how many people are in A versus B versus C. And please feel free to interrupt me. It's hard for me to watch that screen where you all are with my screen over here as to where the presentation is. So I won't be offended if you jump in and ask me questions. Please feel free to do so. Okay, so when it comes to base rates, this is really the guts of rate setting, if you will. So each January, February timeframe, we get your claims data for pharmacy, medical, and dental for the prior 24 months from your vendors. We then take a look at that paid claims data. It's usually updated at least through December. And then we do what is called completing those claims in order to move them from paid dates to incurred dates. And we use prior seasonality patterns, payment patterns, how fast has HSB paid those claims, same thing on ESI side for pharmacy. And then we take those claims through, let's say, December of 2020, and we apply a trend factor to move them forward to plan year 22. The next step in the process is that we will take any upcoming plan design changes that we are aware of. Sometimes that's as simple as looking at the actuarial value changes. Sometimes it's a little bit more involved where we have savings initiatives that are applied. For example, the board voted on 2 of those for both ESI and Health Scope on the out-of-network benefits back at, I believe it was the November meeting. So we'll apply those savings initiatives to our prediction for 22 claims, as well as any pharmacy market checks. This is where we take a look at the current pricing that you're getting on your pharmacy contract. We compare it to some of our latest bids in the marketplace on other clients similar to your size and mix of people. And then sometimes they're able to negotiate for you fairly successfully a decrease in payments for the upcoming year, or perhaps an increase in rebates. And so we will apply that to, again, plan year 22 to do our best estimate of what we think plan year 22 costs will be from a claims perspective. And then in step 4, sorry, my headphones are telling me they're running low on battery, so let me switch out. Can anybody still hear me okay? I'll look to Chair Freed, thank you. And so step 4 is where we first see our friend, the star. So then we are applying enrollment expectations by plan and by tier, along with utilization assumptions by plan and the actuarial values to make an expectation on what do we think the CDHP plan will cost in terms of claims per employee per year based on who we think is enrolling in that plan. For example, if that plan is attracting more families, we're taking that into account. If historically, let's say the HMO plan is attracting a lot of employees plus spouses, we're taking that into account in that step as well. And now that we have the addition of a third plan, we are making our best guess based on industry knowledge and prior assumptions on plan migration as to how many people will enroll into that new third plan. Any questions there? So then we have base rates established in terms of claims cost for each of the 3 different plan design offerings, as well as we have those amounts separated by medical, pharmacy, and dental expected claims. And historically, this is where Aon's part of the process has stopped. And we would send what we called base rate cards over to PEB's office, and the PEB CFO and her staff would take in the process from here. But this is purely getting to our best expectation of what claims costs will be for the upcoming plan year. We have also been given direction by the board to set rates and trends fairly aggressively. Most of our clients are okay with kind of using an industry standard trend, which is a little bit more conservative. I would probably say it's 1 to 2 points higher than the trend that we use for your population. But given the plan performance and savings initiatives that have historically been applied after rates have been set, excess reserves had been generated. So we have been asked historically to make sure we're a little more aggressive when it comes to trend. And then they have asked that there's a 50% chance that our rates will be sufficient to cover those expected claims and a 50% chance that we'll be short.
It's Michelle Kelly here. I have a question just regarding that point. How long has the direction been to do 50-50?
It's definitely been around as long as I've been working on PEB, so that's 6 years. It's possible it's gone before then because it was definitely in place when I came in 6 years ago.
And what's the industry average?
I'm sorry, what average of?
So
what?
You said that the other employers rate it differently from 50-50. So I'm just wondering, what is the average that you see out there? Is there an average?
There's not, but I would say 95% of my clients that I work with don't ever want our rates to be short, because that means it impacts their end of year profitability for their company. For example, if you're talking about like a private employer. And so, they would prefer that we, at the end of the year, when we look back at our claims estimates and say, oh, you came in, 3% better than expectation. I honestly can't think of a single client who prefers me to be short half the time. It's definitely an anomaly.
Okay, and so I guess a question for staff: what would PEBP do if the risk that we're taking here didn't pan out?
So that's why we have catastrophic reserves. Is if our projections are off, that is our reserve bucket, essentially, is our safety net is what that would be.
And how often have we been off in the last 6 years? Just using Stephanie's time on the panel as a number to pick from.
So I believe 2 out of the 6 years we were short and 4 out of the 6 we were under. Historically, we've been within 2 to 3% of the claims pick. Now, there's certainly been, I would say, excess reserves generated off the admin fee portion of it, but the claims pick has been within 2 to 3%. 4 times I want to say it was below, and 2 times the claims ran over what we expected.
Okay, and so we have it. Obviously, we have enough catastrophic reserves because the years that where our claims are under, that money goes into catastrophic reserves, if I'm correct.
I believe it actually goes into your third bucket, which is historically been called excess reserves, but I know you guys relabeled that, I want to say in July, and I apologize for getting the new terminology for that fund.
Differential cash.
There it is. Thank you, Chair Freed. This is Stephanie Messier for the record. I apologize, court reporter, for not doing that before.
Me too.
I also want to add here that Stephanie mentioned that prior to this year, they were not involved after the step 4. That's actually very important to note, because there's a lot that happens after step 4 that changes the entire path. And so not only does trend get changed during the GFO process, but all of the admin costs that are associated with this are just, tacked on to the end. There's a lot that happens after step 4 that has basically undone the entire actuarial, process, basis of this process. And, Stephanie, I don't know if you want to elaborate on that, but I think it's important to just note that because of the history.
Yeah, this is Stephanie Messier for the record. I would say, once again, here is another area where PEB was very unusual. We typically know what our clients' admin fees costs are. We include that, as well as, they'll tell us what they like to see in terms of a subsidy strategy. And so we will take it start to finish. And what we typically present to them would be final rates, and they can tell us whether they like that or not, if they have the money to, take on that year's increase, or if they want to push more to their employees or those kind of things. So typically, again, with the rest of my clients, Aon would take really from step 1 all the way to what's probably step 12 at this point, which is to get you a final rate. But with PEB, we historically have only been involved up through step 4. Okay. Any other questions here?
Tim here, a quick question. So you've been going through step 1 through step 4 for the past however many years, and you said that you've always been within 2 to 3%, give or take.
I will say that for the 6 years I've been doing it, yes.
That's pretty good in my opinion, and I just wanted to express that.
This is Stephanie Messier. I will say Aon appreciates that. Any other questions? I don't want to rush this part. I do recognize that being a math nerd, I love it, but it's not as easy for others. So please, there are no silly questions. I'm happy to talk through it as long as we need to.
I guess it's Michelle Kelly here. So just a point of clarification then. So we talked about, Executive Officer Rich talked about in the past, all the way up to step 4. I think you've expressed before, Executive Officer Rich, that your intent is to involve Aon past that step and into step 5 through 12. Is that correct?
This is Laura Rich. They have been involved, and the reason why is because it maintains. We have actuaries for a reason. No one here at PEB is an actuary, and we rely on their expertise. So if we only use their expertise up to a certain degree, and then at that point decide that their expertise are no longer needed, it undoes the entire, it makes those, what Aon has done up until that point, not sound actuarially, if that makes sense.
Yes, it does. Thanks.
This is Stephanie Messier again. Any other questions before we leave slide 5? One other note that's in the footnote here is that our expectation of the EPO base claims are blended with the fully insured HMO rates that are provided each year by HPN. There wasn't a good place in the presentation to try to put that in there, so it's a little footnote on this slide. Questions about that before I move on?
Yeah, how do you do that? Sorry, it's Michelle for the record.
So we have that, again, it actually deserves its own little star there. So we take the assumption for how many people will enroll by tier for the rates provided by HPN. And then we will multiply those number of people by those tiered rates. And then we will add a similar calculation on the EPO side. So let's say we assume 100 singles, 200 employee plus spouse, et cetera, we're doing that math and then putting the two together, dividing by the total number of people to come up with a new per participant per month rate for the blended EPO HPN base before we start adding in admin.
So just to be clear, so you're blending claims from the EPO with hard premium on the HMO. You're combining those two
Correct.
facts. That is
correct.
Odd. Okay, thank you.
We should probably probe that further because I don't want on the record that it's odd and then we just kind of move past it.
Okay. I guess I think I'm thinking it's unusual. I can't imagine there's too many places like Nevada where we do have that blended experience, right? Where you've got a fully insured product being rated and blended with a fully insured product and a self-insured product being blended to create a combined rate. So it's more the unique nature of Nevada that I was commenting on than necessarily the process.
This is Stephanie Messier. I will absolutely concur with you. That is very much a unique element of PEB that I do not see elsewhere. You are absolutely correct. Any other questions on slide 5? Going once, twice. Okay, slide 6. So there's a bunch of different reasons why enrollments may change from one year to the next. Historically, PEB has seen a fairly stable, I would say, population in the state side, particularly. We've certainly seen progressive reductions on the non-state side. And there's a variety of different reasons why PEB enrollment may change from one year to the next. You know, there's an overall growth or shrinkage potentially of the state's population and employment, certainly in years where there's been more slots to fill. The plan grows. Conversely, I can imagine in harder economic times, there's going to be agencies that are deciding not to fill open positions. Certainly that's coming into play more here as we are in the time of COVID. There's also changes in enrollment by plan, especially when you're offering a new third plan, you're going to see some shifts. I would anticipate both maybe down from the HMO, up from the CDHP, or you may see folks that previously have not been offered, maybe interested in PEBS plans that are coming in, new, taking a new look, maybe previously were uninsured, et cetera. As well as there's movement, obviously, from your actives into your retirement group, the pre-65. So they're still on PEBS plans, but in terms of receiving some other benefits, you may see some shrinkage on the active side, as well as some growth on that pre-65. We would also see pre-65 moving into Medicare for those who are qualified to do so. All of the fun ways that enrollment may shift throughout the year, as well as at open enrollment. Questions here? And as you might imagine, again, we have to make our best estimate as to what PEB is going to look like, not only for plan year 22, but for plan year 23 when it comes to setting PEB's budget. Okay. Next comes another fun piece of the equation. So now that we have our base claims split out by plan and a solid assumption on how many folks will be enrolling by tier and by plan, we add on PEB's administrative fees. So there's a variety of different fees, some of which apply to all 3 self-funded plans, some of which apply to all 3 of the self-funded plans, plus the fully insured plan that has been blended with one of the self-insured plans, as well as one that just gets applied to the CDHP. So currently, based on our best expectations for plan year 22 costs, just the cost of running PEB and paying some of it's like, let's say, IT contracts and those kind of things all fall into the PEB cost line. So that's about $27.27 per participant per month. I believe that probably includes PEB salaries and all of that good stuff, but it's literally the cost of running PEB and some of their contracts, I believe, like with their auditor and other things, kind of all goes into that bucket. And Ms. Eaton can certainly interrupt me if I'm misspeaking for PEB's costs here. Then there's also medical fees. A lot of these are going to be network access fees or fees from HSB for administering the plan. You'll notice the CDHP costs more than the copay plan, which also costs more than the EPO plan. So there is out-of-state networks that gets applied on the CDHP and on the copay. Those fees are not being applied to the EPO plan as there's not an out-of-network benefit. For the CDHP, there is also the additional cost for the HSA administration that gets added only to those folks that need an HSA fund. That way the rest of PEB's participants are not getting charged for something they're not using. And so that's why that one has the largest fees at the $35.27. Any questions there? Okay, hearing none. Next up, we have the pharmacy fees. ESI is charging a different amount to the EPO participants than is being applied to the other self-funded groups. And so those two different amounts are listed there. And then finally, there's the dental network administrative fees of $1.99 that gets applied across the board. That is also, in this instance, inclusive of the amount of people that are, coming just to purchase dental off of the Medicare exchange. They also are $1.99 in terms of the network access for dental. And then finally, for this amount here of $50 per month, I was taking the GovRec plan design at $600 for the HSA HRA contributions. Certainly, if that ends up changing, that number would change, but that's what that assumption is built off of. The $50 per month would assume each participant is getting $600 in their HSA HRA. And that gets loaded strictly to the CDHP plan. Okay. All right.
So can I just ask a
Questions
question?
here?
And you probably clarified this. It's Michelle Kelly for the record, but I just want to, I'm getting tired. So each of these costs, the PEB, medical, pharmacy, dental, and the respective line item that you've got there, are they only added once per tier, or are they added to every adult, for example, and every child?
So right now, we're still looking at each rate as a per participant number. We haven't done the tiering yet. So it's going to get added on here, and then we're going to tier after that. Because for these costs, you do incur more usage, right, if you cover more folks on the plan. So you have more folks accessing the plan in terms of a network, if you're covering a family versus if you're just covering yourself. So it's appropriate to add it here before the tiering gets applied, unlike the life and LTD cost, which doesn't change based on how many people you are covering. That benefit is strictly for an employee. So that is why those costs are being held at this point and not added until after the tiering occurs. These fees here vary based on how many folks you're charging in terms of you're accessing the network more. So it gets applied before the tiering. Certainly, if the board so desired, we could look at doing it after the tiering, but for the sake of trying to streamline the process, we were doing it at this stage.
Yeah, no, I was not making any suggestions. It was truly just a interest question. So, but based on your response then, the HSA HRA funding, because that primarily happens to the primary, right? I mean, there's a little bit for dependents, but so how does that work?
So right now, how we have it set up, this is Stephanie Messier for the record, is that we're, again, trying to get to a per participant per month cost by plan. So given that it's for participants, adding the $50 at this point before it gets tiered is just trying to get it to the total plan cost per participant. Certainly, again, you could look at taking it out and applying it after the tiering. It's most standardly that we would take the per participant per member rate, add in all these additional costs, and then do a tiering and then do a subsidy. In terms of the state subsidy, we call it a state subsidy, and I realize PEB does not call it such. It's by the time you calculate the participant premiums. Again, PEB has all these additional steps, so it's a matter of where do you want to do it. Certainly, again, it could be potentially put at a different step in the process. This was just our recommendation, is to kind of keep it in line with what we typically see, which is to add admin fees on a per participant basis, as well as usually HSA funding, but we certainly could do that at a later step.
Okay, thank you.
Any other questions on this slide? This is Stephanie Messier again. Okay. So next up comes tiering. So now that we have our base claims plus our administrative fee per participant per month numbers that have been weighted by projected enrollment by tier, we then create each of the different underlying tiered rates where PEB has instructed that the participant plus spouse be equivalent to the participant rate times 2. We don't always typically see that. A lot of employers want to load spouses a little bit more. So we'll sometimes see that factor as a 2.1 or a 2.2, sometimes as high as a 2.3. Then next, PEB has a child factor, which we take a look at how much each of your children have historically cost the plan. Children units, I will say. So that does take into account how many children people cover when they typically tend to cover children. So sometimes that could be they cover 1.5 children on average. Sometimes that can be they cover 2. It really varies by client. So here we call that factor Y, which is the cost of a child in relation to the cost of a participant. And then to come up with the participant plus family rate, we again apply the fact that that participant has a spouse. So there's an X plus an X, that's 2X. And then we add in the cost of children units, which is Y, to get to the 2X plus Y family rate. And that's applied consistently by plan. So we don't load HMO heavier than others. I'm sorry, go ahead.
This is Laura Freed. Okay, so this X, 2X, X plus Y, 2X plus Y is the historical policy of the board on tiering, right? And this is what was deviated from in the plan year 21 rate setting at the April 2020 meeting, where we re-tiered to give everybody an equal percentage increase in their participant share of the total rate. Do I have that right?
Stephanie Messier for the record. So to make things more complicated, you almost have it right.
Okay.
But this core estimate remained. There's that next step where we do how much is the state covering of these costs. That changed. And so the base underlying rates is the same. It's just what portion the state pays that changed in the March.
Okay, so the X, 2X, X plus Y, 2X plus Y remains the underlying policy decision. And then the next step is messing around with the subsidy percentage by tier.
This is Stephanie Messier. You are correct, Chair Freed.
Okay, great. Thank you.
Any other questions? Okay. Moving on to slide 9. So then the additional step, which we don't typically see added on to the medical and rates, is the addition of life and LTD insurance. So here, these are the current amounts based on what PEB currently offers today. Certainly, if the GovRec plan design goes through, the LTD cost would fall away. But for purposes of illustration and discussion today, I just wanted to show what those amounts are currently. So for each active participant, they get $842 added to that base cost, regardless of which tier they are in for life insurance, as well as $14.30 for LTD, as well as $1.76 to cover Medicare exchange folks' life insurance. So the cost of those folks gets applied to everyone who is not on the exchange. So we take the amount of insurance that they are receiving, divide it by the number of participants who are active and retirees not on the Medicare exchange, and then they pick up that $1.76 per person. The retirees, conversely, do not have LTD insurance, and they also have a lower life benefit. So you'll notice the life amount that gets added to their rates is lower at $4.21. They also pay for the exchange life folks at $1.76. So for example, a retiree is getting $5.97 added to each tier. So I know we've seen comments in public comment that, we no longer have a X, 2X, X plus Y. You would just have to subtract these amounts out in order to see that relationship hold in the math. And that's a place where PEB, I believe, had a couple of different places where they were applying tier factors in the way the rates were previously set. And again, our hope with all of the changes that we made and approved in the July meeting was that we're trying to streamline this to make it easier to follow. But I still recognize there's definitely still a lot of complications here. Any questions? Okay. So that's it. We have rates. Now moving into the board considerations. So now that we have rates by tier and by plan, we would then apply the amount that the state is willing to provide for each participant by tier. Given that PEB has moved to the flat dollar contribution strategy, they no longer will vary how much they give for each plan. That will remain consistent whether a member picks the HMO plan, the copay plan, or the CDHP plan. There was also in the rate spreadsheet we had received from PEB CFO, there was a factor of 0.85 being applied to dependents previously prior to the March 20 change for plan year 21. And we have maintained that going forward in the budget sheets that have been presented at previous meetings, as well as what's been submitted. So for example, if the state was providing, let's say $585 per active participant, these are the different amounts using the equation presented previously that would be then applied to each tier. Someone covering an employee plus a spouse would now be getting the 585 times 2 times 0.85 for dependent coverage, which equates to $900, essentially $95 if we're rounding for employee plus spouse tier, again, regardless of which plan they select. Then for the children, there's a smaller amount. The Y value for a child unit, children typically are cheaper to cover overall than spouses are, just given their age and less likely to have comorbidities. So your current Y factor is 0.375. So each employee plus children coverage in this scenario, if the state was giving 585, would then receive basically $684 toward coverage. And then finally, the family would get about $1,181. And again, these are applying what was previously in PEB's rate setting spreadsheets prior to the March change, when there was a change in how much the employee plus child tier was receiving.
So I have a question, I guess, Stephanie. Firstly, I think it's just worth asking you, have you been provided with the public comments submitted by Dr. Irvin relating to the rate setting process, whereby he provided kind of a spreadsheet with some alternative formulas? I guess
I did receive it.
Okay, the crux
late
of his
yesterday evening.
Okay, yeah. I think one of the issues that that he identified is that, so up on the top of this slide that we're looking at, it says it varies by participant versus dependent. It's an 80.85 factor for dependents. But when we go down into where you've actually got the tiering, for example, employee and spouse, you're actually applying that 0.85 factor across the employee and the dependent, right? That's what it looks like. And then that's compounding when you go down to the children and the family as well, even though children already have their own factor here. Can you, so I think his formula says employee and spouse. Let's look at tier 2, employee and spouse. It should be 585 plus 585 with a factor of 85, right? Because then it only applies to the one adult. The employee still gets the full 585, but the dependent adult is getting the factor of 85. Because right now that 85 is applying to the employee as well.
this is Stephanie Messier. I'm not going to disagree with the math showing that it's getting applied to both. That's correct. Again, we took the spreadsheet that PEB had been using prior to 2020 in their budget sheet and used those formulas when we updated for the flat dollar contribution. So PEB did not give me permission to go back into the history this morning super early to try to verify all of those numbers. So I did not spend time, verifying the public comment numbers. Certainly, if the PEB board wishes us to do that, they can let us know, and we can dive into that further.
Okay. Is Chairperson, Executive Officer Rich, do you know the history there of why, previously it was applied at just the dependent adult level? Do you know how and why that change occurred, whereby the 85 factor is indeed applying to adult dependents as well? Or is that the intent?
So for the record, Laura Rich, I'd have to go back and look at previous workbooks and do some significant research to find out, when that changed or how that changed or why it was done. I can't tell you just off the top of my head, since previous to myself, I was not involved in that process.
Okay.
This is Laura Freed. Stephanie, would you go ahead and continue?
This is Stephanie, yes, Ms. Freed. I'll move on to slide 12. So when last year the board made varying adjustments by tier, we moved away from the established dependent percentage that had been in the prior rate sheet from PEB. So it was putting additional pressure on the child tier as we move forward into plan year 22, if I would apply the formula that was in the prior sheet provided. So that is where I was trying to give you some numbers to look at under the big circle 1 in the middle of this table. And I do apologize, it's a lot of numbers, but I wanted to give you a sample of what was happening if we don't make an adjustment to the child tier and simply use what was in the spreadsheets prior to that March meeting. So for purposes of illustration, I did provide the current plan year 21 premiums for the CDHP and the EPO plan here for singles through family. And then if we would go back to what was in the prior PEB sheets for rate setting and apply those same formulas, well, the single tier would go up by $16, which is a 37% increase for the CDHP plan. And a spouse would see a $68 increase, which is comparable in terms of a 30% increase. The child tier would increase by $85, which is a 72% increase from what they pay today in plan year 21. So as you might imagine, asking single parents to pay an additional $85 or a 72% increase when someone covering just their spouse or their family is seeing a different increase, it's definitely putting a lot of pressure on that tier. So what we had done in the prior numbers that had been presented for, again, illustrative purposes at the November meeting, as well as numbers that had been submitted, I believe, in the GovRec budget, there is an adjustment factor on the child tier to make the increase more equitable over the course of the plan because of all the percentages being applied throughout the formula. There's no good way unless the board decides that they want to take an active look at each tier, at each rate setting period, to really try to push it all evenly through because of the 2X plus Y to get to the family. They're still seeing a number that's not in the 20 to 40% increase range here under section 2. They are definitely seeing a benefit of only a 6% increase. But the benefit of having the adjustment of 1.05 factor on the child tier is the child tier then receives a little bit more of that state subsidy, and then the employee's cost goes up by $44, which is 37%. In terms of a percentage, it's more comparable to what you're asking the singles on the CDH plan to pay. It's a 40% increase with only a $17 change. And in terms of total dollars, it's more similar to what an employee plus spouse is paying at $46 or a 20% increase. Likewise, there's some similar changes you can see over on the EPO plan. The EPO plan also gets blended again with the AHMO, which has a different tier underlying it when we start off the process. So that's just another way that PEB rates are fun. But we wanted to present these two as different ways that PEB can look at setting a dependent funding strategy on a go-forward basis. Just wanted to recognize that if we put back to what was in previous sheets, there would be significant impact to that employee plus child tier. And we wanted to be fully transparent to the board that if we switch back to that, the rates you would see in March, again, would have that issue, and it may be something that then the board wants to address at that time. We wanted to bring it forward sooner than that to discuss whether maybe option 2 makes more sense, or certainly the board can choose to go in a different direction entirely. We just wanted to try to illustrate with some numbers what's going on behind the scenes. Any questions on slide 12?
Can you, so it's Michelle Kelly here. I'm sorry. Say it again. What is driving that 72% increase on the employee and children? I hear the formula, but what about the formula is driving that increase?
So it's just if you apply this mechanism, which is what was in the prior sheets prior to March of 2020, and would apply that same methodology going forward, it would result in the rates changing by these amounts. So basically, I took that old methodology that was in the prior PEB sheet that I was provided with and moved it forward with underwriting, right, to create 22 rates, and then applied the state amount. And that's how the 585 would get distributed to come up with these rates.
Can we go back to
the way the formula
11?
is working.
Can we go back to page 11? So this employee and children tier, so that I don't show my ignorance, can you walk me through that formula? So how does that, so 585 multiplied by 1 plus y, then it's multiplied by the factor of 0.85? So are we applying the factor of 85 to adults and children in that tier then?
Using the formula that's in there, yes, that's what's happening. So that's how you get to the 685.
Right. So the y factor is already the 0.375 that we're using, right? And then once again, we're reducing that by the 0.85. So it's kind of an error in the formula, right? Or the formula could be changed to account for that error is probably a better way of putting it.
This is Stephanie Messy. You are correct. I believe, based on your policies and procedures, that's something you're dictating. So you can change that. I'm simply, and for lack of a better description, taking what was in the PEB rate spreadsheets before and applying it on a go-forward basis, along with the changes that was requested in July.
So this is Betsy, and I'm trying to follow everything. If this was this was the method used historically, but it wasn't used last year. Is that what you're saying? And that's why it's making such a huge change? Because if it was used every year, it shouldn't be throwing things off this much.
This is Stephanie Messier. That's correct.
Okay.
There was, the board, I believe actually, I think there was a second meeting. It wasn't even in March. I want to say maybe it was March 31st. I know we had 2 meetings in March.
It was
in April?
It was April 9th of 2020. For you folks who would like to go into the archive board materials and read the staff report, it was April 9th of 2020, and the board ultimately voted for option 3 on the staff report, which equalized the percentage increase for everybody's participant share.
Okay, so we had a formula that was used for quite a few years, and it does throw me off, like you had said, Michelle, the 2 times 0.85, but anyway, when it's 2 adults. But so this was the formula that was used. the rates that resulted this past year were uncomfortable to people, so they adjusted the formula. Then when we go back to another formula, it's now making rates again that will be uncomfortable. So in the long and the short, this would probably keep happening every year unless there's some, if the board keeps saying, well, I don't like what happened, unless there's some new formula or something that comes up. I'm just trying to figure this out, because we'll say, well, we don't like what's happening, and then make a change again. And until there's a set process, there's always going to be something that's going to throw it off when you try to go back to this process, I think.
This is Laura Freed. Right. So the point of this item today is to take the policy decision and make something that can be perhaps more enduring, that we don't keep having, this happen, so that it takes one decision off of a anticipated to be very long March rate setting meeting.
But this is Betsy. In the end, the state can only pay so much to fit within our budget. However,
right.
So my question is, there's an issue and a problem here. And because we aren't all mathematical people like Aon is, has Aon suggested a couple solutions? Because I wouldn't know what to come up with sitting here in this meeting. I don't know if other people would. So
this
Aon,
is
have you
Stephanie
looked
Messier.
at suggestions, or maybe it's farther in the press?
So this is Stephanie Messier. So we really just wanted to talk about, if you go back to what you were doing, right, there's going to be some serious disruptions because of what you said. You veered from it one year, and now if you're trying to go back to it, it presents its own issues. Secondarily to that, I think there's still potentially issues with having percents because of when trend comes into play and the state funding that gets set on an every 2-year cycle. You're different than other clients that are setting their budget every year, where if they don't like what they see, if they, something else, they can change it a little bit more readily, whereas you're getting a pool of money for a 2-year period, almost 3 years out, for example. So I would recommend that you not completely go back to what was in the previous file prior to March of 2020. And, based on public comment, it's possible if we dig through other files, we'll find even another formula, maybe a couple more spreadsheets ago. And so we apologize if we didn't go far enough back. But there are different ways to approach this, but a lot of it is usually driven by clients saying, we only want to cover 70% of dependents, doesn't matter what kind of cost they are. Or, they want to set the tier structure based on what the actual cost is rather than sticking with a 2X formula. Because I think the problem you're running into here, based on my opinion, is that you have a very set tier formula, and then you have another percent that's applied to a different percentage on the tiers. And that's where you're running into issues, especially when it comes to the concept of that trend leveraging. So we didn't suggest a third option, but I do think you might want to consider having something that's a little bit more straightforward than what we see here. I certainly wouldn't suggest you go with option one. Just my personal feelings on this one. This is too much, I think, to try to push through to your participants. A 72% increase on the employee plus children tier versus on other plans, they're not seeing that. That definitely doesn't feel right to me, but that's my personal testimony outside of Aon.
So this is Laura Freed. I mean, so Betsy and other newer board members, for quite a while, it was enshrined in the board policies and procedures that the subsidy for an active employee only coverage was a certain percentage, 95% of total premium. And then on, that was the base plan. And then on the HMO, it was 20% less, so 75% subsidy. And then dependent tiers were 15% less than the employee only or retiree only tier. And that was the policy decision. And then 2 executive officers ago, that was taken out of the policies and procedures. So that's part of the history of how we got here. So the X, 2X, X plus Y, 2X plus Y was built into the rates. And then the rates, you know, were what they were. And then you took that board policy and subsidized the total rate accordingly. And so that is a thing the board could go back to.
So it's Michelle Kelly here. A question for Executive Officer Rich. Ms. Rich, have you had a chance to review the submission by Dr. Irvin, and what is your opinion? What is your thought about, you know, because I think he's identified that the primary driver of kind of the inequity, if you will, that's driving the children to be more is kind of applying that reduction factor across all 3 tiers without consideration of the active participant, right? So, and then you've already factored the children, and then you're applying another factor on top of that. So I think that what Dr. Irvin's submission does is kind of remove some of that noise, if you will. But I'm just wondering, I know he's provided it numerous times. We did get it today, but I'm wondering if you've had a chance to review it, what you think about it, if you have feedback on it.
I have had a chance to review it. He actually submitted it to me, I think about a week ago, maybe a week and a half ago, and I did look into it. You know, we are obviously in the middle of juggling not just preparation for this board meeting, but legislative presentations and things like that. So while I did look at it, I will admit that I have not spent more than a short amount of time looking at it and really in getting into the weeds, because I have not had a chance to do that. This is something that I think should be considered by the board. It's what I think the goal should be is to find a methodology or establish a methodology that tiers this in a fair and equal manner, and so that we can not penalize one tier over the other. I don't think that overall this administration in particular would want to penalize one tier over the other. I think originally when the governor presented his budget prior to the pandemic hitting, one of his goals really was to have a family-centered government. So we definitely don't want to tier this so that it's favoring the single over maybe the family, right? So I think that the goal would be to establish a fair way to tier this throughout the different tiers.
So this is Betsy, and I'm sorry, I'm probably way behind everybody or something, I don't know. So the governor has already presented rates for projected rates. And so then how does that fit within us changing the rate methodology to fit within his budget that is showing and the budget we sent to them earlier? Or because these numbers, well, you can't, I'm pointing, but anyway, they match the current on his budget. And so he's got new numbers that he set. And is that based on a methodology or this methodology with that? I'm having trouble connecting some of that.
Betsy, the rates that we are showing are, first of all, they are, as was mentioned in November, they are very premature. We don't set rates until March when we have much more experience under our belts and have the ability to better, to better price those. So these are just illustrative rates just to give the board and the legislature and really, the governor's office as well, an idea of if they do X, what does that do to the rates? If they do Y, what does that do to the rates? And so really it's just to highlight what it might look like, but these are not the rates because the rates are approved by the board in March of every year. And so the reason we're doing this today is because Aon will need some direction for that March board meeting. We don't want to have this discussion in March because we need to approve rates in March. So this is why we're talking about this today.
Ms. Rich, I just wanted to go back to what you were saying before about the goal. I'm not really seeing that and I keep referring to Dr. Urban's example more because it's an example I have in front of me. I think the example Stephanie's provided is kind of a one-off fix again for this year rather than a change of formula, right? So, so I'm sorry to keep focusing on Dr. Urban's public comment, but it is what I have in front of me. I don't see that it is valuing or favoring employee over dependents or spouses, but what I see it doing is trying to correct for right now. If you go back to page 11, that's actually kind of the formula in the policy, or the application of it is penalizing people with dependents and family because it's applying the factor across all tiers except for the employee only, right? So employee only is whole. Every other tier has a flat factor of 80.85 applied across the entire group or the entire family unit, if you will. It's not giving the full benefit to the employee, if you will. And I'm sorry if my terminology is all off and it's confusing everyone. I really apologize. I'm trying very hard. Yeah, so I mean, I guess from my perspective, I would be more interested in fixing the formula, which I think is why it came back to us today, than necessarily approving another one-off fix to a particular tier, because we're just getting more and more off whack. And then in the subsequent year of the biennium, when we have that whole conversation, it's a whole nother deal, right? Which might be minimized if we have a formula that we're comfortable with and that seems to be doing what the board wants it to do.
So this is Laura Freed. I agree with you, Member Kelly, that one-off solutions for each plan year don't serve us very well, and it doesn't provide dependability for the participants, which is why. And the other thing is, Ms. Messier noted that a lot of her other clients are like, okay, well, we want to do subsidize 70% of that, of whatever that is, being the rate card. This is why I'd really like us to get back to a policy solution about subsidy percentages. So we're not applying percentages of percentages. We're just saying, okay, look, based on the claims experience that we have by tier, we know participant plus spouse tends to be more expensive, and we know participant plus child tends to be a little bit less expensive in claims costs. So, that's, I'm urging this board to really consider that. I think it would be the most coherent thing for us to do, both for our own understanding and for the general participant understanding, and for explaining it to decision makers, policy makers.
So it's Michelle Kelly here. So Ms. Rich, how do we do that? How do we get the, like, where do you want us to start as far as developing a formula? Where to now, I guess?
So I think Stephanie had some suggestions on her, that she had spoken about. Stephanie, do you have any recommendations as far as like a formula, or how would you suggest from an actuarial perspective, and also from industry standard, what would your suggestion be?
Stephanie Messier for the record. So I will say there's not really an industry standard. This is definitely a place where, some employers, very paternalistic, want to take care of every single dependent, don't mind that they have a lot of spouses on the plan, subsidize everyone very heavily, versus there may be another employer who doesn't have a lot of money, really just wants to cover the employees and only gives maybe the folks with a dependent, 25% of that. They have to pay the majority of that cost. So it really is, unfortunately, a place where what is the desire of the board and the state of Nevada for their employees? Do they want to say, we are going to cover, back to what Chair Freed had indicated, 95% of employees' cost. And then when it comes to them covering a dependent, we're going to cover 70%. And that would clean, I think, things up. What you have right now, again, is a mixture of a mixture. And the other part comes in is, again, when you apply trend and the way things are today, all of that impact really hits the single tier hard because of the way the formula is working. And I don't know, based on how you are setting your subsidy, that that's really the intent. So it's one of those unintended consequences of when trend hits in year 2 of the biennium, the increase that the single tier sees is nearly double that percent amount of what the other tiers see. So as much as I'd like to say, here's the perfect choice for you, it's really very heavily dependent on the board's knowledge of what the state of Nevada as an employer wants to be. Do they want to be more generous? Do they want to start hitting the single tiers harder? Based on what I've known from the last 6 years, I would say you've definitely leaned more to being very generous to that single coverage, and have been more aggressive in keeping, the spouses out that have other coverage elsewhere. So that indicates to me you want to maintain a really strong value for those singles. But I also recognize in just social media and other things that I've heard your governor is very much wanting to be an employer for families. So I think that should be considered as you're taking this very important step of reevaluating your subsidy strategy. And I apologize that I can't give you an actuarial standard on this one.
So this is Betsy, though. We could, unless we know how this all fits within somewhat of the budgeted money based on the people, I could say I'd like us to cover 95% of it or 60% of this. That's where I'm having trouble, is how do we make this fit within the money? Because I understand where overall as a state, we've been covering the singles more. So that's where, how do we get there within what the budget is allowing? Or maybe I'm just being too concrete. I don't know, but I don't know that we can just throw something out.
So it's Michelle Kelly here. I'd be prepared to make a motion that that Aon starts with what Stephanie and Chairperson Freed actually outlined, which was the 95% for employee only, the 70.70 factor for all dependents, adult or child, and for the first year of the biennium. And then I would request that Aon, using the actuarial data, provide some advice and or a revised formula so that the cost increases in the second year of the biennium, so that the committee could look at the second year of the biennium
either at the 95 factor or at a revised factor for the second year, if you understand that, to to flatten it a little bit. So we have a higher increase in the first year for a smaller increase in the second year, just for continuity for our participants.
Okay, this is Laura Freed. Member Kelly, I have a couple of clarifications. Thank you, by the way. I should have said that first. Do you want, are you asking for a differential between the CDHP and the HMO, first of all? And then to make it even more confusing and complicated, we've, of course, recommended to introduce a copay plan, a middle tier option in the next plan year. And so should we think about two differentials, again, to preempt kind of adverse selection?
You know, I was basing it on the board had already decided to subsidize the plans, the same plans at the same, the different plans at the same percentage, right? But I am open to input on that. I mean, I thought that was already fixed, so it wasn't available. And I'm okay with that, each plan being subsidized at the same factor.
Okay.
But I'm open to suggestion, recommendation, amendment, friendly amendment.
Okay. I mean, gosh, I feel like I'm trying to substitute, you know, being a layperson for actuarial expertise, but just going on the historical stuff that the board has done, I would suggest, you know, a 10 to 15% differential in the between the CDHP and the HMO. And I mean, honestly, wouldn't know where to begin with a new copay plan because we haven't had one in so long.
So, Chair, so I think that the question here is between the tiers, not between the plans, because we have already approved the policy change that we are going to set a flat dollar amount.
Okay. Yeah.
So right. The question here is between the tiers, not between the plans.
Okay. Well, this is Laura Fruit. Sorry for the court reporter's benefits. I'm never very good about that. Then I would concur. I mean, you know, if we're going to say, you know, if we're going to shoot for a goal that is of 95% coverage for employee only, and then I would ask for any, you know, a recommendation of a differential between employee and retiree, because I believe it used to be 20%, but don't quote me on that. I'd have to go back to a really old edition of the board policies and procedures. And then dependent tiers were subsidized at something like 65 to 70% of their costs for all the dependent coverage tiers. So anyway, you know, that's input. That's not necessarily a friendly amendment, but it's just something for Member Kelly to think about as she offers a motion.
Yeah.
So if I could jump in here really quick, Carrie actually sent me the history for the subsidization rate.
Thank you.
And she pulled them up really quickly. So basically, and again, this was prior to the board decision, so it's different between each plan where we're not doing the same today. But on the PPO CDHP in 2016, and really throughout, you know, 2016, 2018, and 2020, it's 93%, 73%, 64, and 44. And we stray from that just slightly on, you know, every in every biennium. And so I sent it to Stephanie since she's sharing her screen. I thought, you know, if you want to share it, Stephanie, if you have it, you're welcome to. But really, it's 93, 73, 64, 44 down the. Okay. Nope, sorry. So it's active. So I'm looking at retirees. So active primary was 93%, and then the It was at the 73% level.
Okay, so there used to be a 20% differential in subsidy between primary and then dependent tiers. And then the retirees were 25 to 30% less on the primary, right? And you're right. I mean, it did get sort of, depending on how much subsidy total, it did get tweaked from the margins. That's true. Thank you very much for that.
The other thing I want to clarify is because you're now doing the flat dollar, if we do the 95, I don't know how prescriptive you want to be, because if I do 95, is it on the weighted average of all the employees over the 3 different plans, or are we doing 95%, let's say on what you call the base plan of the CDHP, and then it goes down from there as they buy up to a richer plan, right? The percentage that you're covering as an employer goes down. You may be only covering 92% of the copay plan and 89% of the HMO. So I just want to recognize that it's not going to be an even percent for each plan across the board because of the flat dollar, which I'm still a huge fan of the flat dollar, because that reduces your potential for errors as people move from one plan to the next. It's really going to help PEB's budgeting if they're giving a set amount for an employee, regardless of which plan the employee picks. Similarly, as Chair Fried mentioned, we do have a separate pool of money, for lack of a better word, that we apply to the retirees, and it's a different number. But again, that same phenomenon will happen from one plan to the next in terms of a percentage that the state is covering.
Right. So I guess, you know, yeah. So I would propose that using the CDHP as the starting plan, I don't want to call it the base plan, the starting plan, that that we subsidize the primary participant, regardless of tier, at the factor of 95%. And then for dependents on any of the tiers, they get factored in at 70%. And then I'm putting this out there so you can refine my language, but then perhaps we can ask Aon to then take the flat dollar figure, whatever that 95% factor relates to, and apply that, whatever percentage that is, to each of the subsequent plans, which kind of, Stephanie, would get at your point of wanting the same flat dollar amount on each plan. So you can do that actuarial work for us and outline it in the formula, right? You can develop the formula for subsequent plans. So the primary participant, regardless of tier, would be the factor of 95%, and then the participant, the dependents, would be a factor of 70% across the tiers. So that way, where every employee gets the full, gets the same, and every dependent tier kind of gets the same. I think I'm making it even more confusing the more I talk, so I'm just going to shut it.
This is Laura Fried. No, I get it. I mean, this is kind of back to the future. I mean, this reminds me of old rates workbooks where, you know, yeah, you could follow through the math of the rates. The rates were set, and then you could see, yep, 95% of this rate, and then you'd see the participant share, and then you'd see, you know, employee plus spouse, 95% of the rate, and then plus the cost for the spouse, and then 70% of that, and then that's the total participant share. So it makes sense to me. I'm afraid we may have lost some other people because I am not hearing a lot of comments.
No, this is Betsy. And I mean, I really like the way that sounds, but I'm beating a dead horse. But is that going to say that our costs are going to go up 3 times what we submitted in our budget, or is it anywhere close? Or because the budget has already been set. I know we have to do rate setting. Maybe because I'm so used to living in these budget things, we always did the rate setting before we did the budget. And so I'm just wondering, are we going to turn around and go to the legislature and go, oops, we told you it was going to cost 2 million, but now it's going to cost 18 million because we're just pulling numbers? Or are those numbers based on something close enough?
Betsy, it's
So
it's
if
how we
this is
allocate
Stephanie-
those dollars. It's how we allocate those dollars. And Stephanie, go ahead and jump in.
Yeah, this is Stephanie Messier. So I would just say if we could be open on the 95%, because if the 95% means that you need to come up with another $30 million, or then the employee rate, now is $10. And again, then the state is giving you more. It absolutely does get to Betsy's problem of, no, the state said they were going to give you X dollars. So if I can at least have a very set differential from the employee to the dependent of, you want that to be a 25% difference. So if I end up only covering 89% of the single, or if I only cover 90% of the single, you still want 25% to get to the dependent, then I can use that and still balance to the state's dollar budget if I'm able to flex that first starting number, if you want to be rigid in the next differential down, for lack of a better description. And please tell me if I just confused you.
No,
that makes this is Betsy. Whoops, I'm sorry. This is Betsy. That makes so much more sense to me because we aren't just coming up with new numbers that weren't sent anywhere.
Okay, so can we turn that into a motion then? What's basically, so Stephanie, do you want to put it into language for us? So you're right. We want the differential to be, 25 basis points as a starting point for the first biennium. So how do we give you what you need in a motion, I guess?
I guess the other point to clarify in order to get a starting point, sorry, Stephanie Messier for the record, is do you want it to stay within $5 of what a single on the CDHP plan member pays today, and that's the starting point?
And this is Betsy, just so I can say, if we say something like 25%, would we turn around then and see that maybe because we had really been doing only 18% before in some cell, one cell's going to be 72% again increase because we're making a huge change, and that's maybe what we need to do to have things make sense in the future. But we're coming up with a formula that kind of makes sense. And what you're saying, Stephanie, I think is trying to match the governor's number maybe for the single active to start with and then work it all from there. But are we going to have, my guess is we're going to have some real weird percentage changes again, which may be a painful thing we have to do to get it back to making sense.
So I think that what we need to do is, or the goal was to give Stephanie and Aon guidance so that way they are prepared to present rates that look like what the board is looking for, right? And so I think that I don't know if we need a motion. I think this is more guidance so that we don't end up in this situation in March where we are having to come back and have an additional emergency board meeting in April. So I think if there's a little bit of flexibility and we leave Aon with some flexibility to present what they feel is logical and makes sense, maybe it's more than one version, we can do that. But I think in general, what we're looking for is guidance from the board.
Okay, this is Laura Freed. So I think in the way of guidance, without taking a motion, it seems clear enough. Folks who haven't said anything thus far at this item, please feel free to shout at me if you disagree. But it seems clear enough that the board's preference is, for primary, active only. Our preference would be to subsidize 95% of the total rate. But if we have to flex on that due to the total number of subsidy dollars that the governor has recommended, we just want to ensure that there is a 25% differential between primary and then dependent tiers. Is that sufficient guidance for you all to go on to present rate tables in March?
So this is Betsy again. And will everyone be comfortable then if some of those rate tables show huge changes and they may not. Because that's what started this conversation to begin with, was huge percentage changes.
I mean, ideally, this is Laura Freed. Ideally, the differential is going to eliminate some of those unintended consequences, because so in other words, x 2x, x plus y, 2x plus y remains the underlying way that we build base rates, and then Aon does the admin load, which is different than, because PEB used to do the admin load itself, and Aon had no visibility in that. And then we get loaded rates, and then it becomes a decision of how do we equitably distribute our subsidy dollars such that everybody's coverage tier is reflective more or less of their claims experience, but also, it's not super unfair whose participant share of the total premium, goes up a lot more than everybody else's from year to year. I mean, I hope that the guidance we've given them will forestall that kind of unintended consequence. And, Stephanie, please let me know if you don't think it will.
Well, this is Betsy again, and maybe
Okay.
I agree with you, Laura. That will prevent it in the future, but I don't know if it will prevent it this year. So the question would be, Stephanie, do you think between the rates now and what we'd be proposing, there would be that unintended consequence still with this method, or do you think it won't look that way?
Stephanie Messier for the record. I think because of the change made in March, it potentially will still look that way. So we'll be prepared at the March meeting to maybe have a proposal that tries to account for that, as well as if we look at the 25 basis points and it really is making huge increases on anybody with a dependent, but tiny increases for any single, we'll be prepared to have a second option that maybe cuts it from the 25 down to 20, trying to give you logical things that you can look at and vote on in March, if that makes you feel any better.
This is Betsy. That would make me feel better. Like if we took the proposal that Chair Freed made, or the motion, and then said, but that we would like Aon, if any unintended consequences appear from following that motion, we'd like Aon to have a second or a third option to present that might help mediate some of those, if that's okay with Chair Freed.
Yeah, this is April. I support that too. I think that's a great idea.
I'm here. I think Chair Freed was just directing Aon for guidance. I don't think it needs a motion. And I'm comfortable with that as well.
Yeah, that was, this is Laura Freed. Yeah, I wasn't going to make a formal motion unless somebody legally thinks we have to.
I don't think you have to. And I was going to ask if there was a motion on the floor. It's up to the board. Guidance is sufficient.
Tom Verducci for the record. I think it would be important for us in March when we look at different scenarios with Aon, that at that point we actually do put in some firm policies in terms of what the percentages would be after we had the opportunity to review what Aon provides.
I think that's this, Betsy, that makes sense to me too.
Yeah, because I don't see how we're going to come up with percentages right now. And we have more to look at in terms of solid percentages. And then if there's some deviations, we could look into that further. But I do think that coming up in March, we should put together some firm policy decisions. So in the future, we do have a point of reference.
This is Laura. Okay. Ms. Rich, Ms. Messier, have we chewed this up sufficiently?
This is Ms. Messier. The only other thing is the biennium year 2 funding, I would love to move to the next agenda item, but the only thing is also when we present rates for plan year 22, do you want any consideration for the fact that if you don't account for any trend change in what the state is providing for year 2 of a biennium, then the full increase hits your employees. Recognizing that that may mean you generate X differential cash at the end of plan year 22 that you use for plan year 23. I don't know if you want to debate that or if we want to just move on with other agenda items for today, but that was what slide 13 was also trying to address.
It's Michelle Kelly here. If it's possible, you know, with obviously within within the contract, I would like to see what it might look like to hold those rates over the biennium pretty flat. But I would also like to see, you know, being conscious of the governor's directive that he did want to keep premiums flat, I would want to see the first year kind of clean, and then maybe you provide some ideas on what it might look like to keep it flat over the biennium. Does that make sense? I don't know if anyone else agrees with that.
This is Laura Freed. My own feeling is that we should probably lower the state funding in year 1 to offset trend in year 2, because we tend to be so aggressive in the way that we ask you to look at our trend. But that's my own feeling.
This is Betsy. I agree with that, because every year claims costs increase, and we don't want to have to increase, like Michelle said, also the premium much for the second year. So we need to maybe have a little bit saved from the first year to apply to paying for claims in the second year to prevent. We might have to have an inflation increase in the premium, but to keep it from having to go up too much.
And just to add to that, the rates that we have illustrated do use that strategy where there's more being allocated in year 2 than in year 1, just to account for that. So that's a strategy that we're already using in place in the rates that you have seen today.
Okay. Well, unless anybody strenuously objects, that's, I think, the board guidance on year 2 funding for the biennium. And we will look forward to a long and spirited discussion at the March board meeting. Thank you to Aon for all the work that you have done, both about, you know, both getting involved in the rate setting in a way that I think you guys haven't been historically, as well as all the special stuff you've done to kind of guesstimate what our COVID claims costs would be as we move through the pandemic. So with that, I think we're clear to move to agenda item 8. And I just want to note for the record that member Krupp had to leave. So we still have a quorum, but she has left. So
Chair Freed, can I request a brief recess?
that is a great idea, Mr. Lindley. Thank you for bringing it up. It's 3:16. How about 3:25? We'll return. Okay. All right. It is 3:24, so I'm going to call the meeting back to order, and I'll let the PEB staff go over agenda item 8.
Okay, so agenda item 8 really rolls all of the policy changes that were presented and approved back in July, and also the policy recommendations that the board subcommittee came up with as a result of for those of you who are not on the subcommittee, as a result of a few separate meetings, which the board members who did participate on this, thank you very much. They put in a lot of time and energy into.
Wait, hang on a second. This is Laura Freed. I think you were talking about a number 9. I think you jumped ahead.
You're right. I am so sorry. All right. We're on like hour 7 now. My brain.
I know we are.
Correct. Okay. Let me pull. I pulled the wrong one. That's what I did. So the LCB, sorry, LCB IT audit. This is just one of many versions of the audit corrective action plans that the board has seen. So back in January of 2020, on January 9th, 2020, the LCB provided the agency with an initial draft of final findings for the information technology audit. And in those final findings, there were a few that were not included because of certain potential security risks and such that if they were made to be public at that time would put us at a greater risk. So the LCB did make those findings public after our IT staff took appropriate measures to reduce those security risks. And that was then presented to the Legislative Commission Audit Subcommittee meeting on January 14th of this year. So as we've done in the past, we have to provide an initial 60-day corrective action plan, followed then by a subsequent 6-month status report. So this is the corrective action plan that has been provided as, or that will be provided, that is being presented today to the board to approve. Basically, the corrective action on all of these, it's pretty simple. We had a lot of outdated servers, antiquated technology that needed to be either retired and replaced or just retired, period. And so the corrective action plan just basically itemizes this and touches on all of these. I do have to say that most of them have been completed, that we are either very close to completing them already or have already completed them. So there's not a lot of concern here as far as how much PEB still has to do to complete the actions necessary by the LCB, but we definitely still have to produce a corrective action plan nonetheless. So I'm going to leave it here and see if there's any questions by any of the board members.
This is Laura Fruit. Sounds like no. So you'd like us to move to approve your corrective action plan then?
That is correct. We need an approval of the corrective action plan so that PEB can submit it to the Legislative Council Bureau.
Motion to approve. Tim here. Motion to approve.
And I will second it. All in favor?
Aye.
Aye.
Aye. Any opposed? Okay, great. Thanks, guys. Okay, now you can talk about item 9.
Okay, so now item 9. This is Regarding the duties, policies, and procedures of the board, to repeat myself from earlier, this really focuses on the approved changes that or the changes to the policies and procedures based on the policy changes from the July 23rd board meeting. So that is the first section, and those are, the items that we discussed. For example, the flat rate, the flat subsidy to all the plans, the streamlining of the tiers. Those are the policies that are changed here. So basically what we did is we went in and incorporated them into the board policies and procedures. The second part of this is to approve the changes that were recommended by the board subcommittee, which before we realized that I was saying thank you and appreciating those board members who dedicated all the time and energy to, coming up with some strategies to really address the audit and specifically the contracting practices that PEB has historically had, and the role of the board in those contracting practices. So Chair Fried, I know that you kind of wanted to take this, and is that something that you still want to do, or we can go through some of this together? How do you want to do this?
The thing I would say is that we had 3 subcommittee meetings, and I'm speaking not on the other parts of the policies and procedures. I'm just talking about the procurement process in section 3 contracts. So that begins on page 10 and goes through page 12. And so you can see the red line changes that were suggested by this subcommittee to kind of strengthen the board's oversight and encourage more board activity around contract review. And I think you saw that today on agenda item 6. Some pretty active discussion about both, solicitations we've got coming, as well as contract approvals, which of course the public didn't see because we did it in closed meeting. But anyway, so in procurement process, letter B2, we kind of made a distinction between routine administrative contracts that the executive officer and her staff can work on, and bigger contracts that affect, the participant group, like the TPA RFP we were discussing earlier. And I want to draw your attention to specifically the, letter D, 2D. The board retains the power and duty as chief of the using agency to appoint members of the board to evaluation committees pursuant to NRS 333, 335. Again, being mindful of LCB's audit, that, the board had been, gotten a little bit complacent, and, we've made some changes that I think will encourage board members to be more active. And the staff has introduced, and if you can see it in the back of the policies and procedures, checklists that would help board members evaluate RFPs as well, and evaluate contract amendments. So hopefully that will be useful to you. And let's see, what else did I want to say? Again, number 8 on page 12, the board shall oversee significant scope modifications and ensure a competitive bid process is followed for amendments involving changes in scope or vendor status, changes that were not within the contemplation of the parties when the original contract was entered, changes that materially alter the contract, quantity of major items, and historically procured services under a separate contract. So this is really all going to, the board needs to keep an eye out for contract amendments that really ought to be a separate contract rather than a contract amendment. And I think that, did I hear somebody speak up? Okay. Anyway, I guess that's pretty much, you know, in the service of brevity. I think that's about my the sum of my comments. Thank you.
So I think, I don't know if any of the other subcommittee members want to discuss this or add to Chair Freed's summary, but if there is no other discussion, what we need is an approval of those changes that were recommended by and this has to go in two different action items, I believe, because of we have a lot of new board members that were not around in July. And so the action item number 1 would be to approve the changes to the board policies and procedures that were approved as a result of the July 23rd board meeting. And then the second part of that are to approve the recommended changes or the changes that are recommended by the board subcommittee.
Tim here. I'll motion to approve the changes recommended by the subcommittee.
This is Laura Freed. I'll second. Okay, board members, this is a vote to approve the red line version of the policies and procedures as it pertains to the contracts section 3. All in favor, say aye.
Aye.
Aye. Aye. Any opposed, say no. Okay, great, that passes. So now the second one is a motion to approve changes to the board duties, policies, and procedures based on the July 23rd, 2020 policy decisions approved at that meeting by the board.
I will make that motion, Linda Fox, for the record.
Thank you, Member Fox. I will again second. Board members, all in favor, say aye.
Aye.
Aye. Any opposed, say no. Okay, great. Thank you. All right, agenda item 10, possible action regarding the withdrawal of funds from the retirement benefits investment fund.
All right, this is good news. It's not every day that you stumble upon a couple $1 million, but we did. So Senate Bill 457 of the 2007 legislative session, it created the Retirement Benefits Investment Fund, otherwise known as RBIF, and set the Board of Trustees as the members of the PERS Board. So this fund was originally set up to be an investment opportunity for the state and local governments to have their assets in a trust and managed in a fashion similar to the PERS fund. So NRS 355.220 authorizes RBIF to invest the money for trust funds established by government agencies for authorized purposes. Specifically for PEB, the money in this fund can only be used for the state retirees health and welfare fund. And so that is specifically in NRS 287.0436. So any monies in this fund can only be applied to address the retiree fund. So only in one instance has PEB used these funds, and it was back in 2010 during the special session. So AB3 directed the state controller to transfer the sum of $24.7 million to that fund created in NRS 287.0436. By the time that withdrawal occurred, the market value of the fund had increased, and so it left a little bit of money in there. And since then, those funds have grown. They gain interest, and they have grown to about $2.1 million. That was as of last week. I believe that may have changed depending on the market, obviously. So the purpose of the fund really is to account for the financial assets that are designated to offset the portion of the current and future costs of the health and welfare benefits paid pursuant to subsection 2 of 287.046. The board does have exclusive control of the fund. However, the funds have to be used, as I said, to offset the cost of retirees. So PEB is currently projecting a shortfall in the retiree category, which is RGGI, of approximately $12 million at the end of FY21. And we expect that shortfall to grow even more because of a decrease in payroll and vacancies in positions. So we are proposing that to help this situation out, we now withdraw the $2.1 million from the RBIF account, and we move them to the RGGI account, or to the State Retirees Health and Welfare Fund is what it is. And in order to do this, the PEB board must submit a letter to the Retirement Investment Fund board requesting that transfer. So PEB can do this on behalf of the board. I think what we'll do is, should this get approved, we can put that letter together and likely just have Chair Freed sign it, and we can send it over to PERS. So the options here are we can actually withdraw this at any time. We can withdraw it today, we can withdraw it in 2 months, we can withdraw it in 2 years. We're playing the market at that point. So right now it is 2.1 million. We can wait a month and it might be 2.3 million, but it also might be 1.7 million. So you're playing the market at this time. So we are recommending that we approve the transfer of all funds immediately, and the transfer funds from the Retirement Benefits Investment Fund to the State Retirees Health and Welfare Fund. So I will leave it there and pause for any questions.
Yes, Tom Verducci for the record. This is for Executive Officer Rich. What was the origination of the fund? Where did the funding originally come from? Was it taxpayer? How did it initially accumulate, and then there was funding that stopped at some point? Could you give me just a little more history on this fund, where it started? I understand the purpose is to offset future costs, but I want to hear a little bit more where it came from.
So I don't have the history behind what happened in 2007. Chair Freed may have that history. I do know that PEB has not contributed. It is up to the agency to contribute to that fund, and PEB has not contributed to that fund since that point. So it sounds like Chair Freed does know the history to this, since she was involved in that arena in that at the time.
This is Laura Freed. Boy, do I remember the 26th special session. Painful memories still. Tom, the RBIF was originally set up in order to pre-fund the GASB liability for retiree health care. So, there was some funding, I believe, appropriated, but the lion's share of the money that was to go into the RBIF was from an increased RGGI rate. And so RGGI, for those of you who don't hang out at PEB meetings all the time, is retired employees group insurance. And that's a percentage of gross payroll assessed on most every budget in the executive budget. And so the RGGI rate was higher than was needed to fund retiree health benefits on a pay-as-you-go basis. And then the difference was going to be sent to the RBIF. And then, of course, the Great Recession happened, and the money that had been set aside to begin that pre-funding of the GASB liability was yanked back out in order to make budget reductions. And so there was, and essentially this is just, budget dust that's been sitting in the RBIF over at PERS ever since. And so Anyway, that's the brief history. But I would be happy to move that the board transfer immediately whatever is in the retirement benefits investment fund into the state retirees health and welfare benefits fund in order to pay for current year retiree healthcare costs.
Michelle Kelly, I'll second that.
All right, thank you. Okay, all in favor, say aye.
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 Any opposed, say no. Okay, great. Thanks, everybody. All right, agenda item 11. We're getting there, friends.
Home stretch. Okay. This is the executive officer report. I'm starting out with the Interim Retirement and Benefits Committee. So on December 16th of 2020, PEB attended and presented at the annual Interim Retirement and Benefits Committee, which is also referred to as IRBC. Statutorily, we are required to present certain reports, and usually those reports are focused on what happened last year, which is great, but it doesn't help the members on that committee understand what PEB is doing moving forward. And so sometimes they're caught off guard when we come into legislative session and they're not approving of actions that the program has taken, after the fact. And so knowing that we were getting into a potentially muddy situation moving into the November, the 12% cuts and into this legislative session, I worked with the LCB staff to ensure that we could also present additional reports to the members of that committee, because a lot of those members are also members of the money committees. And so this would be a good opportunity for us to present a sneak peek as to what they were going to be expecting come legislative session. And I think it was very, very helpful. It gave some of the legislators some insight as to the timing of the PEB program and what kind of activities are required moving up to open enrollment or budding up to open enrollment, and the time constraints that we have if they were to change things at the last minute. So I think that they were very appreciative of that approach. I am glad that we took that approach. Obviously in December when this was presented, we were still looking at 12% cuts. So what was presented in December is not it's still the 12% cut version. However, I will add that PEB did present a pre-budget presentation to the Legislative Commission Budget Subcommittee on Monday. So they were able to see exactly what the board was presented with today in the Agenda Item 5 GovRec report. And so I think that, there were some questions from the legislators around, obviously, the long-term disability. There were some questions about access to care and the networks, the availability of providers within those networks. And there was some concern about the new plan and how that worked. I think there's a desire for education on that new plan. But overall, I think it went reasonably well. And I think that the committee is receptive to a lot of the plan changes that the PEB board has made. The next item is legislative session. So as we all know, we are coming into the next legislative session. So the 81st legislative session will begin on February 1st of 2021. So we're days away at this point. As we do every session, PEB will be presenting information to the board on any bills, any legislation that would potentially affect PEB. because of that and because of the timing, I wanted to make sure the board members, especially some of the new board members who may not be aware, we will be scheduling monthly board meetings. Hopefully they're quick. Hopefully they are not marathons like today. But we will be scheduling monthly board meetings just to give an idea of what is out there and the bills that may potentially impact PEB, what kind of fiscal note we've attached to it, the status, and have some discussion over it. So although agencies typically take a neutral stance when they provide testimony for a bill, it's still important for the board to be able to weigh in on each of the legislation, so that way the testimony that's being provided aligns with the consensus of the board. So we will be reaching out to you shortly to likely put something on the calendar for mid to late January or February, I'm sorry, to ensure that we can provide those updates. Wendy will be reaching out shortly. The next one is an update on SCR 10. In November, the PEB board was provided information on SCR 10, which is a Senate concurrent resolution directing the Legislative Commission to conduct a feasibility study for a public option to improve the stability of Nevada's health insurance market. On January 19th of 2020, Manat Health presented a report to the Legislative Commission. The report outlines two potential public option models. One of them is through the Public Employees Benefits Program, and the other one is through the Silver State Health Insurance Exchange. So in this report, the PEB option would allow Nevadans to purchase health coverage through what would essentially be a mirrored plan, the same plan that is offered to PEB members would be offered to the general population in Nevada. Because of the affordability of the PEB plans and our ability to leverage existing contracts and also the infrastructure that's in place, the projection here is that this option would offer better premiums, more affordable premiums than anything comparable on the market today, including the Silver State Health Insurance Exchange as well, for those who don't qualify for subsidies on that exchange. In general, the PEB option would save those seeking coverage approximately 9% overall, with much greater savings in the rural areas, and then less of a savings specifically in the South. The Manat report also estimates that this option would attract about 6,500 enrollees. So on the surface, this option appears to be a win-win for Nevadans and for PEB, but there are several factors that could potentially have a very negative impact on the program. The first one is the risk pool. So it was determined in their analysis that a new standalone risk pool, so these 6,500 people, would not be viable. Those 6,500 potential enrollees would have to be blended in with the existing state active and retiree risk pool in order for this to be a viable solution. So why is this a problem? Because this option is probably, like I said a minute ago, it's probably going to be most attractive to those people in the rural communities, because that is where the high cost of healthcare really is. And so if we're only taking up people that live in those locations, then it will essentially drive the cost of claims up. And this will have to be absorbed by all PEB members, since they would be in the same risk pool. The other factor to this is that we don't know the demographics of this risk pool. where do they live? How old are they? Are they healthy? Are they sick? We don't know. And so it is very likely that this will also, the demographics that are attracted will also have a negative impact to our rates as well. So the cost in the report, it does estimate that the PEB option is going to cost the program between $7 and $9.5 million. This is mainly to fund required reserves. However, I think that there's some additional costs that were not factored into this that should be considered. For example, our enrollment and eligibility system is not set up for this type of activity. There was also talk about age banding. We do not age band within our system today. We have no mechanism to perform that age banding, so that would be a significant IT lift. And on top of that, we would likely have to coordinate with the Silver State Health Insurance Exchange so that those people entering the marketplace have the option to enter the PEB option through the Silver State Health Insurance Exchange as well. So the second option provides a path for a state-sponsored qualified health plan model offered through the Silver State Health Insurance Exchange. And this model, again, it's shown to be feasible, but it is only feasible if they're able to implement significant cost containment mechanisms, such as setting provider reimbursement caps, which is going to be a highly political feat. So in this option, there's the Manat report does say that the approximate attraction to this would be about 1,500 to 4,900 new enrollees, with a lot of existing enrollees that would go from one exchange plan to this one, obviously. So there would be some migration. But as far as ensuring the uninsured population, it would only be 1,500 to 4,900. So like the PEB option, this also comes with fiscal implications, as well as some required federal and regulatory, state regulatory changes as well. So I provided a full report, the link to the full report of the study, and as PEB receives more information as to whether this is going to move forward into legislation, I will definitely provide the board updates as more. The one thing that I did want to add to this that is not included is vaccines. So I know that vaccines are very, very popular right now. Everyone wants to get one as soon as possible. And I have been working with PEB staff and I have been working with the governor's office to really figure out a way to, or get in front of the need to vaccinate employees, state employees. And so we have started the initial planning of potentially sponsoring some vaccine clinics for state employees based on prioritization. And so hopefully that once we get more information and can move forward with this, I know that there's a lot of chaos surrounding how many vaccines is the state getting and when are we getting them? We're doing as much as possible to plan ahead so that when we do have this information and we can roll something out in terms of getting similar to our flu shot clinic, we want to make sure that we offer vaccine clinics to state employees as that becomes a feasible option. So PEB is excited to work with the governor's office on this and their leadership to ensure that we can take care of our employees accordingly as soon as possible. So I will take any questions, comments, discussion.
Laura Tom Verducci, and the Executive Officer Rich, I think it's awesome that we are providing some relief to the rules. They do need better access. Any savings that we could provide to them is great. Their incomes are less out there, and I think that fills a huge gap and a huge need that we have. I noticed that in the report you do have fiscal implications. I think I heard from your words that it was not a huge impact on the plan, but perhaps could you expand just a little bit on the fiscal implications and the costs that would be associated? Thank you.
Are you referring to the vaccine clinic or the SCR-10?
This will be the SCR-10.
Okay. So the fiscal implications outlined in the report specifically estimate $7 to $9.5 million, and that is really just to generate reserves, those required reserves that will be necessary. But my personal opinion is that I think it will be higher than that just because of the IT needs that the agency also needs. In addition, the staffing needs. There is no possible way we can take this program on or this project on without additional staff. And so there will be, that number is expected to go up if this moves forward.
And just as a follow-up, I know that you've taken on a lot of additional workload. I could see that. And I want to thank you and your staff for the work that you're doing. I think it's great that you've carried on all these RFPs and very nice executive officer report. And just good to see this happening. Thank you.
Executive Officer Rich, Michelle Kelly for the record. As far as the, SCR-10, is there money in the governor's budget to support the expansion of this coverage? Do you know? Have you looked?
That I'm aware of, no. I believe that this would require legislation. And so this would need to be supported by a legislator and move forward throughout the legislative process.
And then just a follow up as far as, because it would impact, obviously, potentially it could negatively impact the PEB rates for state employees, which is the core mission. Did staff get the opportunity to take a position on this? Like when, this is more a process question for me, when would you get involved or the board get involved? Would we get involved if the discussion was to continue to move ahead?
So if the discussion does move ahead, again, it will become legislation. And at that point, yes, the board would get involved because it would become an item that would be listed in the board meetings that we're going to have moving forward throughout the session. And yes, not only would we provide testimony, but there would also be a very significant fiscal note attached to it as well. And so that is one of the challenges in going into the session, is anything with a fiscal note is going to be very difficult to get by because there is no funding available, very limited funding available. So yes, this would definitely come back to the board, and there would be testimony that would be provided should this move forward.
Thank you.
And Tom Verducci, again, for the record, would this require a BDR? Would have to start in BDR and turn into, a bill? And if so, which agency do you think that would be the sponsoring agency of the BDR?
I think this would likely be sponsored by a specific legislator, not an agency in the state. This would need legislative support, someone to sponsor that bill.
Okay. Thank you very much.
Tim here. Quick question. If SCR goes through, because the last board meeting we went through and there were proposed benefit cuts. If SCR 10 goes through and we become in charge of the additional enrollees, would they also be subject to benefit cuts just like active employees?
So my assumption would be yes, but it would all depend on how that bill is written and how it is passed and all the details in that bill.
Thank you.
Executive Officer Rich, just stepping away from SCR 10, do you have a list of BDRs that are already out there that you're watching that you can provide to the board members? I'm interested in kind of starting to set myself up my little tickler. And so if you could, I would love to receive that. I don't know if everyone else would, but certainly if you could share it with me, I'd be appreciative.
We do, and I don't remember the number at this point. It's over 100. I know that we are watching. Unfortunately, I mean, they've started trickling in where, you know, now you're getting a little bit more information on these, but when they're BDRs, it's the language on it is changes to healthcare. And so you don't know what that means until you actually see the text and the language in those bills. So while yes, it is a high number right now, I expect it to, and I know there's a few of them that were on our radar and I've seen since then that are no longer anything that I'm worried about. But yes, that's actually what the board will receive at these monthly meetings is an all-inclusive list of everything we're watching and the status and the possible implications it would have on the program.
Okay. So you can't provide it before you start to structure those meetings?
Happy to provide it if you want it.
Yeah, I would. Thank you.
Okay, Laura Food for the record. If there are no more questions, then we'll move on to agenda item 12, the second public comment period. Take it away, PEB staff.
Thank you. For those who have joined for public comment, your name or the last 4 digits of your phone number will be announced and you'll be advised that you may make your comments. If you're calling in via telephone, please press *6 to unmute yourself. Due to time considerations, each caller will be limited to 3 minutes. Caller with the last 4 digits of 6837, you may begin to make your comments. Please press *6 to unmute. And that caller has dropped. So we'll move on to the next one. Caller with the last 4 digits of 9369. Please slowly state and spell your name for the record and please press *6 to unmute.
Hello? Can
Yes,
you hear me?
We can hear you, yes.
Oh, good. I wasn't sure. I've been listening to this today. You guys got a lot of stuff to do.
Can you hear me? We can hear you, yes.
So anyhow, my thing is that
I've been listening to this today. You guys got a lot of
I've got to go in the other room because if I unmute this thing or drop it. Anyhow, my concern is that I did speak and I wrote emails and everything on your November meeting, and I have been listening to your stuff today, and I didn't hear too much about retirees, and I am a retiree. I'm the 78-year-old notch baby of the state. My concern still is the same things that I had before in my stuff, but I heard something today on, matter of fact, I think she just talked about it on the, is it a public offering that you guys are going to be maybe doing for the PEB that you were just talking about? So anyhow, that is one of my questions. And my concern is that, hopefully you won't be taking me off of the where I'm at now for my Medicare and that, because I do not qualify for anything else. And I know that you guys have got some really tough things to do, so I will keep this as short as I can. I understand your budget constraints, and I'm hoping, and I didn't hear too much about actual rates, so I'm not really sure when that's when we're going to be hearing about that. And for my budget, I have to kind of know as soon as I can. So that's why I've been kind of following in that. I'm just, that's about all I have to say. I would like to know more about the last thing that you guys were discussing. And my opinion is that just right off the top of the bat, the top of there, it's that if you open that up to all people, not just state employees, how I don't understand how that'll work. Anyhow, thank you for your time, and hopefully we'll all be clearer in March. Thank you.
And Madam Chair, that concludes the public comment.
Okay, thank you very much. And I guess then we are finished with our business today. It was a long meeting, and I just want to say to the board members once again how much I appreciate your involvement, your spirited discussion, your sharing of ideas. I think some folks like to blame the PEB board for things that are really beyond PEB board's control. And as the board chair, I get a little protective and a little bit offended when people, kind of imply that we're responsible for furloughs, just to give you one example. So I hope you're all not too discouraged, because not just anybody can, be on the PEB board and make really tough choices and, have the dedication to go through these big fat meeting packets. And so I just wanted to say on the record, I appreciate all of you. And I guess with that, it is 4:11 p.m. according to my computer, and we are adjourned. Thank you, everybody.